Welcome to Coronavirus COVID-19 and TCM, Scientific Research and Clinical Evidence with John Chen. Welcome from Pacific College of Health and Science and LASA OMS, who are co-hosting this webinar. There will be a break in the middle, so if you need to run off, you know there'll be a break in the middle. If you have questions, you can put them in the chat box and we will collect them and get them to Dr. Chen after the webinar. And here's Carl Schwartz from LASA OMS.
Thank you, Cynthia, and thank you everyone for joining us. We're thrilled to partner again with PCHS to bring you this very important content. Also very grateful to Dr. John Chen for all he's done for our profession and for putting together this very, very important work. You know, I know everyone has shifted gears and tried to reinvent themselves during these challenging times. No different at LASA OMS. Just know that you know, there's some really good things happening in the community. We're about to witness one of them, and so that's really what keeps us going at LASA OMS. We're here for you guys as you start to think about opening up and going back to work. You know, reach out, let us know how else we can help. But you know, we are all in this together and seem to be navigating it as best as possible. Now I'm thrilled to introduce our speaker, Dr. John Chen. His participation in the family tradition has led him to become a recognized authority in both Western pharmacology and Chinese herbal medicine. He has taught herbology and pharmacology at University of Southern California School of Pharmacy, University of California San Francisco School of Pharmacy, Pacific College of Oriental Medicine, now PCHS, Emperor's College, Yosan, Bastyr, 5 branches. The list goes on and on and on. He also has given seminars on herb-drug interactions for regional information. So without further ado, I also want to let people know this is running about 3 hours. So that is why we included the break in the middle. But now handing off to Dr. John Chen.
All right, thank you, everyone. First of all, I want to thank Pacific College and LASA OMS for hosting this event. We are all doing this as a volunteer, basically to help to support each other's so we can all get through this tough time together. All right, so once again, thank you to Pacific College and LASA OMS. And I also wanted to thank everybody on my team who helped to put these webinars together. And that includes all the people that did the initial research, the translation, the editing, and so on. You know, so without them, this seminar or webinar would not have been possible. And this is actually the third of the 3 webinars I have done specifically on TCM and treatment of viral infection, influenza, and coronavirus. So the first one, the exact title is TCM treatment of influenza and viral infection. So this is more of a look from a past perspective of how TCM has always treated infection in the past. And then the second one is how coronavirus COVID-19 is treated with TCM in China. So this is more of the present of how TCM has dealt with coronavirus, starting from November of 2019, basically up till about March and April. They were the first to go through this pandemic, and they were the first ones to try a lot of different things to refine their approach, and basically at this time come up with what they believe is the best treatment approach for patients with COVID-19. Okay, and today our topic is coronavirus, COVID-19, and TCM, scientific research and clinical evidence. So what we'll do today is quickly look back to the first 2 seminars, but without spending a lot of time. And then as we go through them, those topics, I'll talk about many of the research that have been done on this topic. So basically, instead of relying on the TCM terminology, which is yin and yang and heat and cold and so on, we can also try to support it, try to make it more understandable to the patients, to medical doctors, nurses, pharmacists, and so on. That way, as we communicate with them, we have a common language. We share the same information. And I think that will bring more light and more credibility to what we try to do for the patients. So in a way, this helps to make the bridge for communication, so we can better work together. Okay, I first did this presentation a week ago, and obviously, things move very fast. But at least this gives you an idea. Anyways, today I think we are at over 3 million cases worldwide and over 1 million in the US. Okay, so as you can see, in just about a week or 10 days period of time, that has already changed quite a bit. Okay, and what has also changed quite a bit is obviously COVID-19 first started in December of 2019, and as of April 20th, if you go to the clinicaltrials.gov website, you see that there are 692 clinical studies that have been submitted to the US government. And that's quite amazing, because to actually put together a study and submit it to the FDA, that takes a lot of work. Okay, so what happened is a lot of work, a lot of organizations have put together something very significant in a very short period of time. So this gives you an idea of how urgent this matter is and how quickly everybody around the world is working together to find a solution to treat this pandemic. So this is 692 studies that are filed in the United States. I'm sure there are a ton more in everywhere else, all the other countries around the world. Okay, and of course, some of these are going to be TCM oriented. So as we come through certain examples, I will definitely share them with you. But most of the other studies are going to be with drugs, antiviral drugs, and also vaccines as well. All right, so this is a very rapidly moving area that every week you're going to have new information. Okay, so the continuing education for this topic doesn't end today. We need to continue to follow up, to learn, and find the best way to address this particular condition. All right, so with that, we'll go ahead and dive right in. And what we'll do today is we'll spend about half an hour or so on the very basic part of the COVID-19. And then after that, we'll go spend the rest of the time on TCM, clinical research, pharmacological research, and so on and so forth. All right, so at this time, there are obviously many different strains of coronavirus, but 7 are known to affect the human. And of the 7, most of them are relatively benign. They cause mild infection, no different than common cold. But there are 3 that have been shown to be quite serious. The first one is MERS, which is from MERS coronavirus. And that particular strain has a 34.3% fatality rate. The second one is called SARS, which is severe acute respiratory disease syndrome. And it's from SARS coronavirus, and it has a 9.6% fatality. And what we're dealing with today is COVID-19, which is the coronavirus disease in 2019 from SARS-CoV-2. And the fatality or mortality vary from 1.38 to 3.4. And obviously that depends on what time frame you're looking at, what country you're looking at. So they all vary to a slight extent. Okay, but overall, what happened is SARS-CoV and SARS-CoV-2 do have a lot in common, both in terms of the genome identity for the virus and also how they attack the body. Basically, both of them focus on their attack on the lung and then secondarily to other parts of the body. So as we look at the signs and symptoms and disease progression and so on, you will notice most of the disease will start at the lung, and most of the treatment strategies will also focus on how to best treat the lung. All right. So as we all know, the virus is spread from person to person, mainly through the respiratory droplet and also through touching, because the virus may land somewhere. And if we touch it and then somehow touch our eyes, our nose, or our mouth, then the virus can then get into our body. Okay, so the very first things that the patient will usually exhibit is signs and symptoms associated with the respiratory tract. Okay, and in the beginning, it will be mainly the upper respiratory tract. So they may have sneezing, runny nose, nasal congestion, sore throat, and possibly lost sense of taste and smell. Okay, so Generally speaking, those are the first warning signs. Okay, so if the patient complains of those signs and symptoms, it's still hard to say what they have. Obviously, they can have common cold or influenza, maybe a bacterial infection, maybe a coronavirus infection. But at this particular time, we need to keep COVID-19 as a real possibility. And then if the disease should progress, they will then transition from the upper respiratory tract and they will go down to the lung, which is a lower respiratory tract. So at this point, they will show signs and symptoms such as dry cough. Sometimes they may have a little bit of sputum production, as well as breathing difficulties and shortness of breath. Okay, so those are mostly the respiratory tract signs and symptoms. And what also happens is the virus can also go through and attack the GI tract. Okay, and 5 to 10% of the patients may show signs and symptoms such as diarrhea, nausea, abdominal distension, abdominal pain, before they show fever and dyspnea and the rest of the respiratory tract signs and symptoms. All right, so once again, it does attack the respiratory tract and also the GI tract. And then lastly, regardless of whether it attacks the respiratory or digestive tract, patients will also have systemic signs and symptoms. And most of the signs and symptoms include fever, lethargy, muscle aches and pain, headache, and also dehydration. All right, so what happened is this is the picture you want to have in your head that as a patient complain of signs and symptoms like this, obviously you want to suspect whether these patients have a contagious disease or not. Okay, and generally speaking, if at all possible, they should go and get tested if it's available at all. Okay, so a month ago, 2 months ago, when I did the first and second webinar, tests were very hard to come by. In fact, in most cases, the patient may have exact signs and symptoms, but they'll go to the hospital, they'll go to a clinic, and there will be no test available. But I think in most clinics today, if they go to the right place, they should be able to get a test, and that makes a big difference because it will determine whether they need to be quarantined or not. But the treatment itself still remain mostly the same. Okay. Anyhow, then what happened is let's go in a little bit deeper. Okay, so instead of just the general signs and symptoms that we just described affecting the upper respiratory tract and lower respiratory tract, what happened is eventually the virus will settle down and will affect the smallest part of the lung or the respiratory tract, and that's the alveoli. All right, so as you can see here, this is the upper, this is the lower, and eventually the virus will settle down in the alveolar space. Okay, so if we were to dive in even deeper, this is what the alveolus looks like. All right, this is basically the smallest part of the air sac that we exchange oxygen and carbon dioxide between the lung and also the blood vessel. So as you can see, this is the alveoli. Okay, and lung has 2 main type of lung cells. The first one is called type 1 alveolar cell or pneumocyte. And this is a cell that conducts the oxygen and carbon dioxide exchange. All right. And then you have type 2 alveolar cell or type 2 pneumocyte. And this is the blue cell that's over here. And what this cell does is it produces something called the surfactant, and that keeps the lung or the alveolus in a bubble or balloon type of shape without collapsing. That way, there is a maximum amount of surface area for the air to come in and the air to exchange with the blood vessels. Okay, so in a healthy person, in a healthy alveolus, this is exactly what happened. Air, oxygen goes from the outside to the alveolus, across the membrane and right into the blood vessels, and then obviously carbon dioxide do the opposite. Okay. Unfortunately, then what happened is if the patient does have a COVID infection, then what the coronavirus does is as it comes in, it will affect this blue type 2 alveolar cell. Okay. And then what's going to happen is the virus will go inside the lung, will affect the lung cell, and then slowly will cause the lung cell to die. And as the lung cell dies and it pops, it goes through apoptosis. Then all the viral particles are released into the airspace. So the virus can infect other cells. And then if the patient coughs or sneezes and so on, the virus will go outside and then infect other people. All right. So now what happened inside the alveolus is that the lung cell is dying, the virus is coming out. So the macrophage is the first line of defense that will then come in and try to take care of the situation. So macrophage is like the Pac-Man cell that will come in and try to eat up the virus, eat up the debris, but at the same time, you will release cytokines. And cytokine is the inflammatory signal that signals to the rest of the immune system to come help. Because macrophage by itself is not enough to clean up this virus infection. So once the cytokines are released, and this is mainly going to be interleukin-1, interleukin-6, and also tumor necrosis factor. So once they are released, those cytokines will signal the immune system to come help. So now you're going to have the neutrophils and the monocytes and all the other immune cells that will come through the blood vessels, and then they will try to go into the lung for help. But what happened is the blood vessel member, the space here is too narrow. So one of the things that has to happen is the blood vessel has to dilate and the permeability has to increase for the cells to get through and go into the lung. Okay, but for that, also after that happens, what happened is, in addition to the blood cells getting through, you will also have a lot of fluids that will flow from the blood vessel into the surrounding space, okay, over here. So what happened is you will end up with a lot of inflammation, a lot of swelling, a lot of fluids over here. And those fluids will also not just stay here, but get inside the lung as well. So as you can see in this diagram, that what used to be an alveolar space that's full of air now has a lot of debris. It has a lot of fluids. It has a lot of virus. It has a lot of lung cell particles, a lot of cytokine, and so on. And what all that's going to do is make breathing more and more difficult, right? So this is the reason why the patient has shortness of breath, they have wheezing, they have difficulty breathing, and so on. And at the same time, all this fluid here inside the alveolar space, this is basically the phlegm and the sputum. Okay, so in the beginning, it may be hard to cough it out because in the beginning, there may be just a little bit, but as the time goes on, as the disease becomes more serious, they do have sometimes some sputum production, okay? And that depends on, in part, how much of the fluid that's over here, all right? And then once again, as the disease progresses further, okay, if it's not corrected, then what happens is, once again, you have more and more of the fluid inside the lung, inside the alveolar space. You have more fluid in between the alveolar space and also the blood vessel. And at the same time, you have the neutrophils, which are the purple cells over here that's inside the lung. And what happened is neutrophils kill the virus and kill the debris or infected cell in a different way. You know, it will secrete toxic chemicals really to kill the foreign substance. And these toxic chemicals, what happened is, unfortunately, not only kill the virus or kill the infected lung cells, they will also damage all the other cells, okay, as well as a membrane inside the alveolus. So this is what leads to a lot of the damage inside the lung. And then once the damage occurs, you have the fibroblast, which needs to come in and repair the damage. And once the damage has been repaired, you have scar tissues, you have fibrosis of the lung. All right, so this is a severe case of COVID-19 damaging the lung, causing severe problem with breathing, triggering hyperimmunity and excessive damage to the lung structure. And this is basically what they call the cytokine storm and also the ARDS, acute respiratory distress syndrome. Okay, so this is how SARS becomes so dangerous, and this is how COVID-19 becomes so dangerous, because at this point, what happened is the patient cannot breathe, and if they cannot breathe, there's too much, space, fluid over here. What also happened is the fluid outside also causes the collapse of the lung, because the pressure will push the air sac in. Okay, and then finally, the patient is just not getting enough oxygen from the alveolus to the blood vessel, and they end up with hypoxemia. And now what happened is the blood and the oxygen is not getting to the blood vessel, it's not going to the rest of the body. So now the patient is at risk of multi-organ failure as well. Okay, so what starts from the upper respiratory tract, may go to lower respiratory tract. It may start from mild, may progress to moderate to severe, and eventually may become life-threatening. Okay, so this is how the patient can go from having a mild signs and symptom, eventually become hospitalized, have to go to ICU, and eventually go on life support. Okay, so it's kind of that progression of the disease. Okay, and if we need to go that even deeper. Okay, so in addition to how the whole respiratory tract look like and what alveolar space look like, let's now look at just inside this blue lung cell. This is a type 2 pneumocyte. Okay, and we look at it and examine exactly what happened to the virus inside the cell. All right, so this is a diagram from chemistry views showing that this is the virus in the air sac. Okay, and this purple space here represents a pneumocyte. Okay, so what happened is the virus is floating from the upper respiratory tract to the lower respiratory tract. And what happened is the virus needs to find a way to land on the affected cell and be able to go in. Okay, so the very first key step is that the spike protein, which is on the outside of the coronavirus, needs to find a place to attach. Okay, so this is kind of like the lock and key theory that they teach you in class, that the spike protein is a key and this receptor here is a lock. Once they find the exact match, the two will click, and basically that will enable the virus to go through endocytosis and then go to inside of the cell. All right, so once again, this is a spike protein, and the receptor on the outside of the lung cell is called ACE2 receptor, which stands for angiotensin converting enzyme 2 receptor. Okay, so this receptor is specific at several parts of the body. It is present to the lung. It is present in the digestive tract. It is present in the kidney, and also to a smaller amount to the cardiovascular system. Okay, so because the receptor is present in the lung and also in the digestive tract, that is one of the main reasons why as coronavirus attacks the patient, lung is the #1 place that they go to, and then the digestive tract is the second. Okay, so these are the first two places that start to show signs and symptoms. Okay, and later on, if the virus get into the bloodstream and attack the rest of the body, then they do affect the kidney and they do affect the cardiovascular system. All right, so let's go back to the virus. Okay, so now what happened is the virus is attached to the ACE2 receptor, goes inside the cell. Once it goes inside the cell, the membrane or the envelope on the outside opens up and releases this green RNA into the cell, okay, into the host cell. So this is now when this virus starts to do its damage, okay? Once the virus releases its RNA, it needs to do two things in order to multiply itself, okay? And those two things are, #1, it needs to make more of its own RNA, and it also needs to make more of the proteins that make up the spike protein, that make up the shell, that make up the membrane, and so on and so forth. So the first thing that has to happen is you need a process or a enzyme called the RNA-dependent RNA polymerase. So this is the enzyme that make the process possible for the virus to produce more of the RNA. So that's the critical step for the virus to duplicate its own RNA. And the second one is something called a translation. And this is a process in which the virus hijacks the cell's ability to make proteins. So instead of the cell making its own protein, the cell is now making the protein for the virus to use. So this is called proteolysis. And there are two main enzymes here. One is called 3CL proteinase, and the other one is called PL proteinase. And these are the steps that will make the spike protein, that will make the envelope, that will make the membrane, and so on. So once this is done, what happens is the protein will combine with the RNA through an assembly and packaging process before it makes all the rest of the virus. So this is, in a way, a very abbreviated life cycle of how the virus is attached to the receptor. It goes inside, makes more of its own RNA, makes more of the protein particles before they are combined and released So more virus can affect other lung cells. And when they are coughed out through respiratory droplet, then they can affect more patients. Okay, so this is what's happening inside the lung cell. And the reason I have to go through all this is because from a both drug perspective, and also when we look at some of the herbs and some of the formulas on how they actually treat COVID-19, there are in fact many studies that show down to this molecular level how the herbs are working to help to treat the viral infection. Okay, so it's quite surprising, but a lot of the herb research have gone, quite to the details like this. All right. So now that we know the background behind the pathophysiology and also the virology, let's look at the diagnosis and treatment. All right. So diagnosis in Western medicine is very straight and simple forward. It's simply COVID-19. All right. And if you look at the diagnosis from Chinese TCM perspective, what you have is quite a few. You have wind cold at the exterior, wind heat at the exterior, damp warmth in early phase, damp cold in the lung, damp heat in the lung, toxic stagnation obstructing the lung, toxic heat in the lung, epidemic toxin blocking the lung, Shaoyang syndrome with damp and closed interior and abandoned exterior. Okay, so quite a few different differential diagnoses. And now let's look at treatment. In Western medicine, there's no treatment and there's no cure, at least not at this time. Okay, from TCM perspective, this is only a small list of herbal formulas and not even single herbs for treatment of COVID-19. And for many of the references that I look, in general, I would say you're looking at probably 20 to 30 different herbal treatments. Okay, so that's quite a few. So you may be wondering at this time, why such great contrast? And the reason is because Western medicine generally focuses on the microscopic level. So when they talk about diagnosis of COVID-19, that's exactly what they look for. And treatment, again, once again, there's no specific antiviral treatment at this time. There's no vaccine at this time. So there's no treatment and there's no cure. But what happened is the TCM doesn't look at the virus itself, but rather it look at the person or the patient who has the virus. Okay, so depending on how the patient presents themselves, whether it's early stage, mid stage, or late stage, how their body responds. Okay, then what happened is we are treating the patient. Therefore, there are many different differential diagnoses, and there are even more herbal formulas because every patient is different, or their signs and symptoms are different, their severities are different, their prognosis is different. Therefore, it's not a one-size-fits-all type of phenomenon. Okay, so the main point here is not to show who is right and who is wrong. They are both right and they are both not necessarily wrong. But in a way, they can both learn something from each other's. So what we hope to do by the end of today is to learn something from Western medicine and learn something from Chinese medicine. And hopefully we can see the big picture and take the best of both worlds to come up with the best treatment strategy for the patient. Okay, so that I think really is the ultimate goal. Okay, and since most of us are here to learn about Chinese medicine, what we'll do now is we'll look into the past, how TCM treats viral infection in the past, look at the present, and also look at it from Western medicine perspective and also Chinese medicine perspective. So we'll start with the past. I'll start from the main TCM theories. So in the past, what happened is two of the main theories when it comes to treating infectious disease are primarily Sanghan, which is cold damage, and also Wen Bing, which is warm diseases. All right, so you really cannot talk about TCM for treating infection without talking about these two main theories and schools of thoughts. So let's start out with Sanghan first. All right, Sanghan basically is a theory developed by a physician named Zhang Zongjing, who lived between 150 to 219 Common Era. Okay, so about 2,000 years or 180 years in the past. Okay, and what happened was Zhang Zongjing lived and grew up during a time of transition from Eastern Han to the Three Kingdoms. So what happened is basically it's a constant civil war between different regions inside China. And that happens to coincide with a huge epidemic during that time. So what happened is you have a lot of people that die from the war, from the infection, from the famine, from malnutrition, and so on. And you have said that during a 10-year span, approximately 2/3 of the population in China die. Okay, so that is quite dramatic. You know, we can't even begin to imagine what would the world look like today if you look, 2/3 of the people were to die. That's quite unimaginable. In any case, that was the inspiration behind why Dr. Zhang Zhongjin decided to become a physician. So he spent his life learning, treating patients, and toward his later years, he put all his experience in writing. And that's how we ended up with two of his masterpieces. Okay, one is Sanghan Lun, and the other one is Jin Gui Yao Lue. Okay, Sanghan Lun is discussion of the co-induced disorder. And this text specifically focused on the pattern of externally contracted disorders. So basically diseases that start from the exterior, then attack the person, and then goes from the exterior to the interior through the stages of Taiyang, Yangming, Shaoyang, then Taiyin, Shaoyin, Jueyin, right? So we have all learned about this in school. And those are basically the 6 stages of the externally contracted disease. And Jin Gui Yao Lue, Essentials from the Golden Cabinet, deals mainly with the internally generated disorders. So these are the disorders that come from the interior as a result of maybe lifestyle, maybe diet, maybe internal imbalance. So these are the internal organ issues, maybe the Zang and Fu. So those are the solid organs and the hollow organs, maybe out of balance of the yin and yang, and so on and so forth. So basically the main contrast is the first one is from external source, and the second one is for the internally generated. And this is going to become important later on when I talk about different treatment strategies. So I wanted to highlight that to bring that to your attention first. All right. So as far as COVID-19 goes, this is obviously a disease that's externally contracted. So once again, most of the treatment strategy, most of the diagnosis will then focus starting from Taiyang to Shaoyang to Taiyang to Yangming and to Shaoyang, right? So from exterior, slowly progressing interior. And one of the formula that is frequently used today is Ge Gen Tang, which is kutsu decoction. So this is a formula that has been used for a long time and it still is used today, basically to treat the early stage when the exterior factor attack the Taiyang stage. And the signs and symptoms are mostly of wind cold nature, right? So the patient has muscle aches and pain, mostly affecting the neck and the back, aversion to cold, with or without fever, aversion to wind, absence of perspiration, and interestingly, also diarrhea, right? So this is very similar to the COVID-19 patients when they first have the virus attacking the respiratory tract, maybe the upper, maybe the lower respiratory tract, and also the gastrointestinal tract. So you have mostly upper respiratory tract signs and symptoms, but also diarrhea, right? So this is a great formula for the patient at this time in the early stage to release the exterior pathogens, relieve the muscle aches and pain, lower the fever, and also promote the generation of body fluids. Okay, so this body fluid is not necessarily your blood, but in this case, mostly it's your mucous membrane inside your nose, inside your respiratory tract. All right, and this is very important because if you don't have an adequate amount of mucous membrane inside your respiratory tract, then what happens is a virus, as it comes in, as you breathe it in, can get stuck inside, penetrate across, and get into the inside much easier. Because one of the main functions of the mucous membrane is to act as a trap, to trap the virus, to trap the dust, to trap the foreign particles. And then you have the cilia, the little hairs that will then push it out of the body, so they don't have a chance to infect your lung. Okay, so what happened is most of the infections affect us in wintertime, partly because during winter when it's cold, we tend to stay indoor, we tend to crowd each other's, and at the same time, we turn on the fireplace, we turn on the heater. And then with heat, what happened is they will dry up the air, dry up the humidity, and that will cause the mucous membrane inside our nose and respiratory tract to become narrower. So once again, that makes it easier for the virus to cross and affect us. And also at the same time, as the air becomes more dry, the viral particles will be suspended in the air longer, making it easier for the other person to breathe it in. Okay, so during wintertime, if you do have the heater on, by all means, turn on the humidifier at the same time. So that will keep the air moist, that will cause the virus to fall down faster, and that will rehydrate your mucous membrane. Okay, or if you take a gentang, once again, you will promote the generation of body fluids. So it's an herbal way to internally help to generate more mucous membrane. All right, so this formula overall is a great antipyretic formula to bring down the fever. It's a good anti-inflammatory formula to relieve the muscle aches and pain. Okay, but if you were to look at the composition of the formula, okay, none of them are really herbs that clear heat or eliminate toxin. None of them really have antibiotic or antiviral effect. So what happened is this is a formula in a way to ease the suffering for the patient, so they are at an optimal health to help to fight the viral infection. The formula itself doesn't really fight and kill the virus directly by itself. All right, so that is the first line, that is the Taiyang stage. And then once again, as we mentioned, if the disease happened to move further interior, as it goes to the lung, then at this point, usually the patient will show some type of lung heat signs and symptoms. So lung obviously refers to the part of the body that's affected, and then heat refers to infection or inflammation type of condition. All right. So at this point, we need to use herb to treat lung heat, and this is one of the most commonly used formula for COVID-19. This is called Ma Xing Dan Si Tang. Ma refers to Ma Huang, etc. Xing refers to Ku Xing Ren, which is the Armeniaca seed or bitter almond seed. Si refers to Si Gao Zhifen fibrosin, and Gan refers to Zhi Gan Cao. So this is I think, a perfectly matched formula to not only treat lung heat, to relieve cough, to reduce fever, and so on. It's also perfectly have the herbs that have check and balance with each other, right? So herbs will maximize the effect and minimize the side effect. And what I mean by that is Ma Huang sometimes can be too hot and cause side effect. So then you have Si Gao that will keep the warm property in check. And then vice versa. Si Gao sometimes is too cold, then you have Ma Huang to help to neutralize the temperature. Okay, and then of course you have Zhi Gan Cao to harmonize the whole formula. So overall, this is a great formula to ventilate the lung qi, to clear lung heat, to relieve cough and asthma, and so on. And because COVID-19 primarily attacks the lung, this is a very important formula and probably also the most commonly used formula for treating COVID-19. All right. And from a Western medicine perspective, what happened is Ma Huang is mainly an anti-asthmatic herb. Ku Xing Ren is mainly an antitussive herb, because our Chinese term is that it directs lung qi downwards, okay, but basically to stop coughing. And then Si Gao is antipyretic to reduce fever, and Zhi Gan Cao is anti-inflammatory. And to go one step further, this is to help to explain exactly how it does it, okay? This is a study that looked at the pharmacological effect, not only of the formula itself, but also all the ingredients. And what they found is that the formula obviously has very good antitussive and antipyretic effect. But then beyond that, they also have very good anti-asthmatic effect. So anti-asthmatic is mainly an effect that's carried out by Ma Huang ephedra. And Ma Huang has many of the ephedrine alkaloids that will stimulate both the alpha and beta adrenergic receptors to then dilate the lungs. Okay, so that's primarily how Ma Huang works to treat asthma. But at the same time, what happened is these receptors, especially alpha receptors, are also present in the cardiovascular system and also central nervous system. So what happened is when Ma Huang stimulates the receptors in the cardiovascular system, the blood vessel will constrict and the heart will beat faster. And that's why the blood vessel goes up and the heart rate goes up. Okay, so that would then be a side effect. And at the same time, Ma Huang will also stimulate the central nervous system. And that's why these patients get more nervous, they get more anxious, they may become more excited, and that's why they have insomnia, and so on and so forth. So Ma Huang is one of those herbs, it's like a sword with two sharp edges, right? It has a great effect irreplaceable effect to treat asthma, but at the same time, it may cause side effects to the cardiovascular system and also to the central nervous system. Okay, 苦杏仁 in Chinese medicine is described to direct qi downwards. So that's how it helps to treat cough. But what happened is, what it really does is it has an ingredient called amygdalin. And what it does is, after you absorb it, it goes to your brain, it goes to the central nervous system to suppress the cough reflex. So that's really how it exhibits the antitussive effect. And then sigao in Chinese medicine, it's a cold herb that helps to treat fever. But really, how it does it is it helps to decrease the prostaglandin E2 level, and then that helps in turn to relieve the hyperthermia or the fever, right? And ganchao is an herb that harmonizes the formula. It has an anti-inflammatory effect. And how it does it is that it regulates the pituitary adrenal axis. And basically what that means is it will help to increase the production of the adrenal glands, mainly the glucocorticoids, to help to reduce inflammation, because your glucocorticoid is a very powerful internal anti-inflammatory agent. So that's mainly how ganchao works to reduce the inflammation. So once again, these are 4 herbs. Each one of them has a very specific TCM effect, and that's also perfectly explained from a Western pharmacological effect too. You know, basically to match each other's very well to treat lung heat, which is a lung infection and lung inflammation condition. You know, so this is an excellent formula. It's a great formula to treat patients with wheezing, with dyspnea, with allergy-induced or infection-induced infection and inflammation. All right, and then furthermore, this is another journal that studies the effect of 麻杏甘石汤 on respiratory resistance and airway leukocyte infiltration in asthma guinea pigs. So basically what they're doing is the same thing. They find out that this formula has a great effect to stimulate the beta-adrenergic receptor to dilate the lung and treat asthma. And then in turn, once the patient's asthma condition gets better, then they will not have the hyper-responsive effect from the immune system, meaning the neutrophils go into the lung cell in a great number to produce chemicals to damage the lung. Okay, so it's an indirect effect, but nonetheless, it will help to reduce the neutrophils, reduce the hyper-responsive response from the lung. And the bottom line is reduce lung inflammation and reduce lung scarring. Okay, so Ma Huang not only treat the symptom or infection and inflammation, it also reduces the consequence of lung inflammation and lung scarring from hyper-responsiveness from the immune system. Okay, so once again, excellent formula, and there's also a lot of research studies on that formula. And speaking of research study, I think one of the most, if not the most extensively studied formula is Xiao Cai Hu Tang, which is our next formula. This one is known as the minor pupulorum decoction. All right, so at this point, as the disease continues to move interior, what you now have is a disease that goes from Taiyang to Shaoyang, or Taiyang to Yangming, and now to Shaoyang, right? So Xiao Cai Hu Tang is the standard formula for treating Shaoyang syndrome. And the main herb is Cai Hu pupulorum, but at the same time, it has Huangqin to clear heat from the upper jiao to bring the disease outwards. You have Ban Xia that treats the dampened phlegm, and then all the other herbs. But Cai Hu and Huangqin and Ban Xia, these are the 3 primary herbs. And at the same time, it also has Rensen. Okay, so this is an herb to help to strengthen the qi. Okay, and keep that in mind because this is going to be important in a minute. So what happened is Xiao Cai Hu Tang in Chinese medicine, like we mentioned, is to harmonize the Shaoyang syndrome. So as a disease is progressing inwards, it's now stuck in the middle. It's not going any further inside to the in stage, but it's also not moving outwards to the Yangming or Taiyang stage. It's kind of stuck in the middle, and there's alternating spells of chills and fever. There's hot chest and hypochondriac fullness and pain, irritability, bitter taste in the mouth, nausea, vomiting, and so on and so forth. Okay, and what that means in Western medicine is that Western medicine has no such a thing as Shaoyang syndrome. But if you look at the clinical application, what you'll notice is that Xiaocai Hutang probably has one of the widest Western disease biomedical indications, including hepatitis, liver fibrosis, liver cancer, jaundice, cholecystitis, pancreatitis, nephritis, right? Hepatitis, common cold, influenza, measles, bronchitis, pneumonia, and the list goes on and on and on. Okay, so I'm fortunate to be trained in both TCM and also in Western medicine. And I can tell you that there's no such thing in Western medicine where you have one drug or one medicine that's able to treat so many different things. There is just no such thing, okay? So I've been struggling for a long time to come up with a good explanation of why that is the case. And for a long time, I have a very hard time. And obviously, if you look at the pharmacological effect, what happened is for every disease that it treats, there is a pharmacological effect to describe it, right? So this formula is most commonly used to treat liver disorder. And in fact, there is a lot of studies that shows that it has a very good hepatoprotective effect, that it has an anti-hepatic fibrosis effect. So that's basically to prevent the fibrosis. It also helps to move the bile acid and treat gallstones. So that's a choligogic effect, and so on and so forth, right? Anti-allergic, anti-tumor, and anti-ulcer, anti-asthmatic, and so on. So once again, there are a lot of different pharmacological effects. There are a lot of biomedical indications. So how does one formula do all these things? You know, and that's quite a big challenge to explain. And in the end, I think what happened is, you know, for any one formula to do so many different things, generally speaking, what happened is it's not a one-directional type of effect. You know, so what I mean by that is Western medicine, as far as drug-wise, it's one compound, right? It's one substance. So they tend to have one effect. You know, they're either agonists or they're antagonists. They either affect one enzyme or one receptor. That's just the nature of how one molecule and what one molecule is able to do. But what happened is with a formula, there are so many herbs and so many different compounds. So a lot of times it's able to do what I would call a regulatory effect or modulatory effect. So in other words, it helps the body to help itself. If the body is out of harmony, is in excess condition, you will help to bring it down. If the patient or the disease condition is in a deficiency condition, you will help the body to boost and bring it to the equilibrium. So that's the regulatory effect. So I think what happened is Xiaocai Hutang minor purpura decoction really does have a regulatory effect. And what it regulates is the immune system, okay? Because the immune system helps to treat a lot of different things. It's not just the infection, but well, it's not just the viral infection, but also the bacterial infection. And then what happened is as it affects the physiology of the body and different organ system, sometimes the immune system does not respond properly, right? You know, we see that all the time today with with autoimmune disease, you know, where the immune system can no longer differentiate what is the normal, healthy self tissues versus the pathogenic foreign substance, right? So the immune system is getting confused and it's attacking the body, and that's leading to a lot of different complications. So I think Xiaocai Hutang definitely has that effect to help to regulate the immune system, and that in turn will help to treat a lot of diseases that is, like I said, stuck in the middle. It's a Shaoyang syndrome type of disease in which the immune system is confused, is no longer able to treat the disease. And that's why the patient ends up with all these different biomedical disease on a chronic basis, and that's not getting better. All right, so from a COVID-19 perspective, there are definitely evidence to support that Xiaocai Hutang has what we call the immunomodulatory effect. So once again, that's a regulatory effect on the immune system. So what it really does is it helps to significantly inhibit the overreaction by the immune system. So it helps to reduce the excess amount of leukocytes, the eosinophilic inflammation. It helps to downgrade the T helper cell type 2, cytokines, chemokines, and also decrease the mucus hypersecretion by the IgEs. So basically, as we talk about cytokine storm, or you know, the milder cases, where you have too much of the neutrophils and monocytes that go into the lung. They produce too much chemicals, they produce too many cytokines and chemokines, and that's what triggers the cytokine storm. So Xiao Cai Hu Tang helps to suppress the hyperactive immune system, to regulate the immune system, to make sure the immune system does just what it's supposed to do, but doesn't go overboard. Okay, so that way the body does not cause cytokine storm, does not trigger ARDS, and then in turn cause more complication and cause more disease on its own. So that's what I think Xiao Cai Hu Tang really does in this case. All right, and one of the caution is that this is an drug interaction caution. Years ago, they have noticed that when in Japan, when you have patients with pre-existing chronic hepatitis or liver cirrhosis, and if these patients are also treated with interferon alpha at the same time by MDs, and then they are treated by Xiao Cai Hu Tang by the OMDs, by the TCM practitioner, what they notice that basically there's too much stimulation or the immune system gets confused. And as a result, the neutrophils cause more damage to the lung tissue and therefore in turn cause pneumonitis and pulmonary fibrosis. Okay, so this is something quite unique, and it's only something that's documented and noticed when you have the combination of patients with pre-existing liver condition that's taking interferon and also taking Xiao Cai Hu Tang at the same time. So those are the triad, the three main things that has to happen before the interaction is documented. For all the other circumstances, Xiao Cai Hu Tang is not known to cause pulmonary fibrosis, is not known to cause lung damage. Okay, so this is an important drug interaction to keep in mind. And they are not sure exactly how this happened on a molecular level. Is it Xiao Cai Hu Tang itself as the formula? Or is it perhaps the ginseng, the ginseng that's in the formula, right? Because what happened is ginseng of all the herbs in that formula is the main herb that tonifies qi, but it also has an immune boosting effect, right? So if the immune cells produce interferon, the patient is also getting interferon through Western medicine. Now you give ginseng to boost the immune system. Would ginseng be the reason why this happened? Okay, and if that's the case, if you were to remove ginseng, would that mean Xiao Cai Hu Tang is safe? Okay, so those are hypotheses that has not been tested. But if you were to use Xiao Cai Hu Tang in patients that have risk of cytokine storm, or maybe patients that have autoimmune disease, then generally speaking, the common sense is that you don't want to use ginseng because it may boost the immune system, or you don't want to use huangqi, astragalus, because it may also boost the immune system. Okay, and you can explain this from a TCM or Western medicine perspective. The TCM perspective is if the patient already has lung heat, which they have, right? Then you probably don't want to use a hot herb like ginseng because you will create more heat. So that makes sense. If you look at it from a Western medicine perspective, these patients already have hyperactive immune system, right? They have possibility of cytokine storm, or they have autoimmune disease, right? Then of course you don't want to use ginseng, which has an immunostimulant effect, or huangqi, which has immunostimulant effect, because you will likely create more harm than good. So once again, regardless of whether you use TCM rationale or Western medicine explanation, you arrive to the same conclusion, and that is don't use ginseng and don't use huangqi under these circumstances. All right, so that is Xiao Cai Hu Tang, and once again, like I mentioned, this is the Shaoyang stage, where Xiao Cai Hu Tang will help to harmonize the interior and the exterior, and help to bring the disease and vent it outwards. All right, and then if necessary, Se Gan Ma Huang Tang Bialan Kanda, and ephedra decoction is also a formula that is quite frequently used. Okay, so Se Gan is Bialan Kanda. This is a great formula to warm up the lung, to clear heat, and also to help to eliminate the phlegm. And then Ma Huang ephedra is obviously an important formula to once again ventilate the lung. Okay, another very important herb is Xi Xin, the sarum. This is an herb that helps to warm the interior. So if the patient has a phlegm that's deep in the lung, that's very hard to get rid of. This is an herb that will help to warm up the lung, that will help to loosen the phlegm so the body can get rid of it. And then the rest of the herbs, such as Ziwan, Asteris, Guangdonghua, Fafara, Banxia, Panelia, is to help to get rid of the phlegm and bring it upwards and outwards. All right. So the indication of this formula is ventilate the lung, dispel phlegm, direct the lung qi downwards, which is to suppress the cough and also stop coughing. Okay. And the TCM indication for this condition is called tan yin, which is loosely translated as phlegm retention. So that was my translation about 12 years ago when I wrote the formula book for tan yin, phlegm retention. And now looking back, that translation did not quite capture the Chinese essence of the words, because what happened is tan yin really refer to two separate phenomena. Tan is basically the visible phlegm or the tangible phlegm. So what that means is it's something that you can see and something you can feel and touch. Okay, and in the more accurate translation is this is the invisible phlegm or the intangible phlegm, something you cannot see, something you cannot touch or feel. And I also looked up the Weissman translation, and Weissman translates in as room. And room, I also looked it up in a dictionary. Basically, it's a watery discharge from your nose. And I looked at it and I thought about it, and I was thinking, wait, that's not quite right. You know, I mean, because the TCM yin really is something far deeper inside the body, something that you cannot see. It's not a nasal discharge that's loose or watery, but something you can see. And let me show you what I mean by that, you know, with a graphic demonstration. Hopefully, you'll make a lot more sense. So once again, you know, we go back to the alveolus, right? We talked about the patient that have COVID-19 in severe cases. So what happened is inside the alveolus, right? We have the virus, we have the dead lung cell, we have a lot of the phlegm, we have what's called the protein-rich fluid. You know, so this is basically a combination of protein, cellular debris, a lot of, you know, maybe scar tissues or particles. So this is something that's a combination of many different things. Some are loose, some are more thick, and some are more sticky. But nonetheless, okay, the patient tries really hard, you are able to cough it out, right? So in the beginning, not so much, but later on, you are able to cough it out. And when they do cough it out, then it's called sputum in Western medicine. You know, so this is the productive phlegm. This is the tan, T-A-N in Chinese medicine. But what also happened is, imagine even if you are able to get rid of everything inside the alveolus, what happened is you also have a lot of fluid that fills up the space, the interstitial space between the alveolus and the blood vessels. Okay, so these are the fluid that comes out as a result of increased permeability in the blood vessels. So this is the fluid here that will cause the lung congestion, the lung feeling of oppression that will cause wheezing and dyspnea. So even if we were to get rid of everything inside the alveolus, okay, so there's no more phlegm, what happened is the patient will still show greasy tongue coating, they will still show slippery paws, they will still have symptoms such as, you know, feeling of oppression in the chest, right? So what happened is, even if they have dry, non-productive cough, and you may think, they don't have any phlegm, but they do. Now they have yin, right? Y-I-N, the intangible, the invisible phlegm that is trapped between the alveolus and the blood vessels. Okay, so inside the middle here, this is your tan, visible phlegm, and in between the alveolus and the blood vessel in this interstitial space, this is your yin, the invisible phlegm. Okay, so the combination of the two is then the term tan yin. All right. So when you look at the Chinese literature, there are not a lot of formulas that are specifically to treat tan yin, and this is one of them. Segan Ma Huang Tang is an important formula to treat tan yin, and basically what that means is the disease started from the exterior, it moves interior to the lung, and not just the lung, it triggers the hyper responsiveness of the immune system that is starting to attack the lung itself and is starting to cause problem with the complications. So this is no longer just a disease from the virus. It's a disease that comes from the interior and the imbalance that's caused by the immune system. So if you were to look at the origin of this formula, it's no longer a formula from Sang Han Lun cold-induced disorder. It is a formula at the bottom here from Jin Gui Yao Lue, essential from the Golden Cabinet. So Zhang Zongjing knew from way back then that this is an internally generated disorder. And this formula is to treat the internal imbalance itself, right? So it's quite amazing how you have all these formulas and how they are classified differently. So once again, when the disease progresses to a point where virus is no longer the main problem, it's the immune system and the hyper-responsiveness and the over-responsiveness that's causing the problem, is now the internal problem. Okay, so this is the formula that treats Tanyin, the visible and the invisible phlegm. And what it does is not just to get rid of the phlegm as what I originally had, which is anti-asthmatic effect, antitussive, and expectorant. That's too elementary, right? The formula does a lot more than that. The formula, in fact, helps to get rid of hyper-responsiveness of the immune system in order to treat and get rid of all the pulmonary edema and all the proteinaceous discharge. How it does that is mainly, once again, by regulating the hyper-responsiveness of the airway and regulating the immune system in order to correct the pulmonary edema and all those other conditions. So this is the exact study that demonstrates that point, right? The name of the study is Gan Ma Huang decoction, eliminates asthmatic airway hyper-responsiveness by downgrading the immune system. And exactly what it does is it down-regulates the hyper-responsive part, which is a T helper cell 2 and T helper cell 17 differentiation. So that helps to suppress the hyper-responsiveness of the immune system. But at the same time, it upregulates the T regulatory cells to help to suppress the hyper-responsiveness. And at the same time, inhibits the excessive cytokine production and alleviate the asthmatic airway hyper-responsiveness. So overall, Gan Ma Huang Tang also has an excellent immunomodulatory effect to regulate the immune system and correct the immune system imbalance. Okay, so once again, all the formula we talked about so far, whether it's Ge Gen Tang, Kuzhu decoction, Ma Xin Gan Si Tang, Xiao Cai Hu Tang, or Gan Ma Huang Tang, what happened is they all help to regulate, modulate, optimize the body and its physiology and its anatomy, so the body can best help itself to fight the virus. Okay, and the last formula is no different. This last formula is called Wu Ling San, 5-ingredient powder with poria. And all the herbs are primarily to help to get rid of the water. You have Zexie alisma, Zuling polyporus, Fuling poria, Baisu atractylosis, and also Guizi cinnamon twigs. They regulate water circulation, dispel dampness, warms up the yang qi, and disperses water accumulation. So what happened is, once again, you have a lot of edema, you have a lot of water accumulation inside the lung. So to really get rid of it, you have to provide an outlet for them to be eliminated for the body, from the body. So mainly it's to treat accumulation of the water and dampness by draining them downwards, and also to get rid of the tanyin, the visible and invisible phlegm accumulation. All right, so primarily a diuretic effect, not just the water from the edema, but water from the lung as well. Also, this formula has a great nephroprotective effect, so to protect the kidney. Okay, so this is good in the more severe case if the coronavirus happen to go inside the body. So it's no longer affecting the lung and the digestive tract, but it's actually attacking the kidney. This formula will help to protect the kidney. And there are many different references that shows, in fact, it does that. Okay, so this is a formula, a study that shows this formula, in fact, help to treat artificially induced renal damage due to diabetes. And these are two studies that once again shows that Wu Ling San plays a part to help to treat kidney damage caused by ischemia or kidney fibrosis. Okay, so the cause is a little bit different as far as what actually triggers the kidney damage. But nonetheless, it shows that this is a great formula because in part by improving the kidney function, you help to reduce the workload for the kidney and helps to prevent kidney damage. Okay, so once again, Wu Ling San helps to get rid of water, helps to treat tannin, helps to protect the kidney. Okay, so this is a formula that also plays a part to help to treat the overall COVID-19 condition. So if you haven't noticed by now, okay, those last four formulas, in fact, make up the most important formula in this book called the Guidance for Coronavirus Disease 2019. And what this is this is a book that's compiled and published by PPRC. They are actually in their 7th edition, right? So this coronavirus started in December of 2019, and they worked very, very quickly to come up with their best differential diagnosis and treatment. They evaluated and they continue to refine it. So starting from January, February, March, April, and so on, they started from 1st edition all the way to 7th edition. Okay, so right now you are at 7th edition, and the book is available in both Mandarin Chinese, of course, but also in English. So this is the 6th edition that's available in both, from page 1 to page, I think, 260 something. But in any case, it talked about many different treatment approach, both from a Western medicine perspective and also from a TCM perspective. And basically for PPRC at this point in time, they have come to the conclusion that this formula called Qingfei Baitu Tang is the best and the most suitable formula for patients with COVID-19. And this is called Clear the Lung and Eliminate Toxin formula. And how they make up this formula is this is a combination from 4 formulas. The 4 are Ma Xing Gan Si Tang, okay, which is Ma Huang, Xing Ren, Gan Cao, Si Gao Tang, ephedra, apricot kernel, licorice, and gypsum decoction, combined with Xiao Cai Hu Tang, minor bupleurum decoction, Se Gan Ma Huang Tang, Bellum Kanda, and ephedra decoction, and also Wu Ling San, 5-ingredient powder with poria. And these are the exact composition, all the herbs and also the ingredients. Obviously, it's not an exact 4 formulas combined. There are some variation, modifications. And some of the modification is, number 1, Rensen is no longer used. Okay, so like we mentioned earlier with Xiao Cai Hu Tang, that if the patient has a risk of cytokine storm or immune system hyperresponsiveness, then Rensen is perhaps not suitable. And that's why it's not used here. And then another herb that's removed is Weizi, which is Shisandra berries, because the author who wrote this formula also determined that it's no longer suitable. Okay, but in any case, the bulk of the formula is made out of those 4 formulas, and the rationale is pretty much as I described. Okay, so what PPRC is promoting is that they ask all physicians, all hospitals, and all formulas to use this formula as the first-line formula, if at all possible, to treat COVID-19 patient that's in their early stage, moderate stage, and even severe stage. And obviously, the formula is fine for early to moderate, but if it does proceed or progress to severe stage, this formula by itself is no longer sufficient. And what they do in TCM in China is that they will also use other formulas. They will use herbs in oral injection or in ingestion in decoction form. They also make herbs into injection, and they inject the patient as needed. And at the same time, they also use Western medicine as well. They have used a lot of different antiviral treatment. They have used a lot of different, I guess what Western medicine would call non-standard treatment. But in any case, they recognize that this is a novel coronavirus. This is a new disease. And the only way to find out what the best treatment is unfortunately, you have to do some trial and error. So they did do a lot of different trials. Some did not succeed, some did. So after thousands and thousands of cases, they come up with their best treatment approach, and this happens to be the one. Okay, so in their initial report, they report that of 701 patients in 10 provinces with COVID-19, The initial observation is that 130 recover and discharge from hospital. 51 had resolution of the signs and symptoms. 268 had improvement of the signs and symptoms. 212 has stabilization. So overall, the rate of effectiveness is 94.3%. And then as they continue to move forward, what happened is not only do they have a better idea how to treat these patients, they can start to treat these patients earlier. The hospitals are no longer as crowded, so they can provide better care. What they notice is that the success rate becomes even higher. So in the follow-up report, as they continue to gather records, the latest observation, and this is dated on April 17, is that of 1,262 patients, 1,253 completely recovered and were discharged. So the effectiveness rate of effectiveness is up to 99.28%. Okay, and then non-deteriorated from mild or moderate case to severe case. And symptom and signs were resolved mainly within 3 to 6 days. And they tested negative for COVID-19 within 10 days. And generally speaking, this formula, how it's used is with all those herbs. They will make a decoction, and they have the patient take the decoction twice a day for 3 consecutive days. And if the condition still remains, they will generally give the patient the same decoction for another 3 days. So generally speaking, the treatment period is somewhere between 3 to 6 days. And that's why you see that most of the signs and symptoms are resolved within 3 to 6 days. And then they are tested 10 days later, and most of them show negative test for COVID-19 within 2 times within 24 hours. And generally speaking, that's a protocol before they are pronounced to be COVID-19 negative and they are discharged from the hospitals. So 99.28% effective rate is quite impressive. Okay, so if you're interested, the links up below. You can click the link and look at. You can read the more details. And this is a report announced by, I believe, the vice president of the Beijing University of Traditional Chinese Medicine. So it does come from a very credible source, but it's in Chinese, so I don't know if you're able to get it translated or not. But in any case, this looks like the most promising herbal formula for treating COVID-19 at this point in time. And to share with you a update, and this is like the research that we mentioned at the beginning of the webinar. What I have been doing quite a bit is I have been working for a research project, and this is a research project sponsored, spearheaded by 3 universities. One is UCLA, one is UC San Diego, and one is UC Irvine. So basically what they are doing is they are collaborating to do a clinical study for treatment of COVID-19. Okay, so these patients have to be positive for COVID-19, and then they will be treated either with placebo or with Chinese herbal medicine. And what they want to do is they want to see if traditional Chinese medicine can be used to help to reduce the rate and the need for hospitalization. Okay, because right now at this point in time, of all the patients that test positive for COVID-19, overall about 81% or so have mild symptoms that really don't need to be in the hospital. They can go home, they can be isolated and quarantine. And generally speaking, 81% will heal and recover on their own. So 19%, the other 19% may need to be in the hospital, and 4% may need to be in the ICU. Okay, so that's without any treatment. So what they are hoping is the use of Chinese herb intervention can help to reduce the rate and the need for hospitalization. So hopefully bring down that 19% as much as possible. Okay, and obviously the study will most likely start with a small pilot trial. And if that goes well, then it will be moved on to a larger clinical scale. So that's quite exciting, and that's what I've been working on with the UC schools. And hopefully we will work out all the details with the FDA and proceed to the pilot study within a short period of time. But generally speaking, this is something that's quite challenging. There's a lot of obstacles to go through, but I think this is quite a crisis. So everyone is moving at a much faster rate, and FDA as well. So as we find out additional information, then we'll definitely share it with you. Okay, but one of the challenge we have to face, or we have to go through, is determine what we are going to do with 3 herbs that are, generally speaking, not available in the United States. Okay, and those 3 herbs are Ma Huang, ephedra, Qixin, asarum, and Guangdong Hua, phafara. And Ma Huang, as we all know, is the first herb that we study in Chinese herbal pharmacopoeia. And then Ma Huang Tang is the first formula we study in herbal formulas. So it's quite sad that it's no longer available in most cases to TCM practitioners. Anyways, function of Ma Huang is to release the exterior and relieve wheezing and dyspnea. So the main compound that does that is basically the ephedrine alkaloids. Ma Huang comes from 3 main plants. One is Ephedra sinica, Ephedra intermedia, and Ephedra equistina. And all 3 have ephedrine alkaloids. What happened is, a lot of questions that I get all the time is, does the Mormon tea have ephedrine alkaloids? Will it do the same thing? And the answer is, of all the research I look into, the Mormon tea is the same. It's from the same ephedra genus, but it's not from the same species. So it doesn't have ephedrine alkaloids. It's not going to have the therapeutic effect. It's not going to have the side effect either. So that option is not available. If you do use this herb, the Ephedra sinica, the Chinese herb, then obviously keep in mind that it has TCM cautions, and that is Ma Huang is extremely warm, extremely hot, and acrid. And that also translates to the side effect. Basically, it's a very stimulating herb, right? You'll stimulate the cardiovascular system and cause all the cardiovascular system side effects. You will stimulate the central nervous system and cause all the central nervous system side effects. So patients that have the TCM pre-existing condition or Western medicine pre-existing disease condition, though the ones you see on the PowerPoint here are the caution that you should exercise. And as far as the replacement go, I'll talk about the replacement last. As far as Xixin goes, asarum goes, okay, this is an herb that both release the exterior and also warm the interior. Okay, and the reason that we can no longer use this herb is because Xixin asarum belongs in the family of Aristolochiae, and Aristolochiae family or genus of plants pretty much all contain aristolochic acid. And aristolochic acid, unfortunately, has been found to be linked to nephrotoxicity, hepatotoxicity, and also carcinogenic. So it may cause kidney damage, liver damage, and also may cause cancer. So any herb that contains aristolochic acid is pretty much banned in any non-Asian countries. So that includes primarily North America, Europe, and so on. All right. And lastly, Guangdong Hua is generally called phafara and also called Tusigo or coat's foot. And in TCM, it moistens the lung, lowers lung qi, dissolves phlegm, and stops cough. But unfortunately, this is an herb that does contain pyrrolidazine alkaloids, which includes the compounds sancurkine and senencionine. And what happened with pyrrolidazine alkaloid is that this is an herb or a compound that, if it's given at large doses, has been linked to hepatotoxicity and also carcinogenicity. So basically may cause liver injury and also may cause cancer. And once again, is no longer available for most of Europe and also most of North America. But what happened is, this is something that most herb companies do not know and most herb practitioners do not know. Okay, so what you notice is that Guangdong Hua is still imported, is still used by practitioners. And for that matter, FDA probably didn't know that either. And the reason is because luckily, no toxicity report has been generated. So my guess is FDA and the FDA inspector really does not know that Guangdong Hua contains pyrrolidazine alkaloid. So they are letting it import it into this country. But legally speaking, liability speaking, you really should not prescribe and use this herb. All right. So what do you do? What are the best substitutes? What happened is for quite a while, different practitioners have different ideas, and I had an idea that, the best way to find the most appropriate substitute is why don't we go right to the source? And the source is Zhang Boli. This is one of the practitioners from China that in a team of practitioners came up with the formulation Qing Fei Pai Du Tang. So I was fortunate to attend one of his webinars. And this is a webinar he had basically for, well, actually it's for the whole world, not just for the United States, but it's sponsored by people here in the United States. Anyways, it was a 1 hour, 1 hour and a half webinar. He talked about COVID-19 in China, what they have done. And toward the end, he took a lot of questions. And one of the questions that we asked was, these are the herbs that are not available in the US. So what would you recommend as the most suitable substitute? And what he said was, for Ma Huang ephedra, the best substitute is Xiangru, which is Mosla, or Elshosia. Okay, and he said this Xiangru in Chinese medicine is generally described as the summer ephedra. So it's not as strong, but it does have effect to release the exterior and also to ventilate the lung. And the textbook description of the dose is 3 to 10 grams. So in most cases, you probably need to lean toward heavier dose, so maybe 9 or 10 grams or so. And then Qixin releases the exterior and also warm the interior. But in this case, it was used as part of Gan Ma Huang Tang to warm the lung to get rid of Tanyin. So a good substitute is Ganjiang, dry ginger, to help to warm the interior. But because Ganjiang is quite warm, he says to keep it at low dose, so 6 grams instead of 9. Okay, and the last one is actually my personal recommendation. So if Guangdong Hua is not available, then Pipa Ye, which is Eriopotria leaf, is the best substitute, in my opinion. Okay, and the dose for this herb is about 6 to 10 grams. Okay, yeah, so these are the substitutes if you happen to want to make the exact same formula, and you need to find herbs to substitute. Okay, so these are the herbs, these are the recommendations and the dosage. And Zhang Boli, it's basically like Dr. Anthony Fauci in the United States, who is looked at as the authority on what to do during this crisis. And Zhang Boli is basically the Chinese equivalent in China. He has been very active in speaking to within China and also to people outside of China. Okay, so yeah, so he has been a great voice of calm throughout this entire crisis. All right, so I think now is a good time to take a pause and take a break. We just finished Sanghan. So I think Lhasa, OMS, and also Pacific College is going to give you some, I guess, message, and then that will also give me a chance to take a break. So I'll give it back to Carl and also Jack.
Thanks, John.
Thank you. Thank you very much, John. And for everyone watching, as Dr. Chen just said, we're going to spend a few minutes talking about each of our respective organizations, give him a little break. He's just getting warmed up, so he will be back and take you through the rest of the lecture. For Lhasa OMS, we decided to take a little bit different path tonight, and wanted to focus on an area that, we see stories here or there, but we really wanted to share some really uplifting stories. So, at a time when so many negative stories are flooding the news in our inboxes daily, it's very easy to overlook the positive things that are happening in our industry, in our country, in the world. The truth is, there really is so much kindness that's happening right now. And there's really countless everyday heroes, and we wanted to take the chance to use our time today to recognize them. Now, there's just a few. I only have a few minutes, so apologies if we left some out. We'd love to hear stories that you've heard, but I am going to share. Miles, I'm trying to. So we thought we'd focus on the kind of news that we need right now. And in some ways, speaking for us at Lhasa OMS, these are some of the stories that really help get us through the day and kind of drive our activity. First one I want to recognize is Acupuncturists Without Borders. Right when this started, they mobilized their small team with huge hearts and went into action to help support frontline healthcare workers. They created videos and other content and started sending out ear seed kits to help those workers treat themselves for stress, anxiety, and exhaustion. In many respects, they're creating these kits in their garages, and they're relying on donations. AwesomeS happily supports them through product donations and otherwise. But you know, in some ways, they're actually reaching into their own pockets to make sure that those frontline healthcare workers have the help that they need. So if you are not familiar with acupuncture without borders, I highly recommend and encourage you to visit their website, donate if you can. Every little bit helps them. And this is the kind of news we need right now. I'd also like to recognize Net of Knowledge. They are the largest online learning platform we have and a good partner with AwesomeS. Again, as soon as this started to happen and the shelter in place orders started to come through, they started to reach out to their vast network of educators and have created an unbelievable list of free webinars that are happening daily. And for an organization, AwesomeS, we sponsor and host 1 to 2 webinars a month. I can tell you how much work goes into just that alone. It is daunting to have a daily webinar. And they are doing it, you know, with some of the most renowned educators that we have in our industry. They also immediately offered a 20% discount on all of their online CEUs. You can purchase them at AwesomeS and then take them on their platform. And you know, these guys are just working tirelessly. So I'd like to you know, thank John and Dylan Stan for their efforts and help in the industry. And this is the kind of news we need right now. Dodi Chang is a licensed practitioner in the New York City area. She called me actually in early March and said she had a patient who was telling her he could get access to PPE. And she wanted us to talk to him because she wanted practitioners in this country to be as safe as possible. So she wanted us to be able to have access to that, those products that we can then sell to practitioners. We started talking and I was asking what else she was working on, and I was just floored that she didn't start with that. She made it her mission, and others in her community made it their mission to get goggles, face shields, and food. And she rushed into the hospitals in Brooklyn and other areas of New York that people were rushing away from. These were the hot spots, the flashpoints for the infection, and it was growing so fast daily. And she made it her mission to make sure those frontline workers had the gear that they needed to stay safe and continue to help people who were suffering. And so, you know, thank you, Dodi, very much. This is absolutely the kind of news we need right now. Bell Garden Isolation Unit, organized by a Western medical doctor, licensed acupuncturist, Dr. Alan Chang. You know, together with recommendation from an acupuncture board member, Los Angeles County Department of Health Services accepted the addition of Chinese medical practitioners into the hospitals and into the healthcare system. And working together, they are absolutely helping patients. And we'd like to thank them for their efforts. This is absolutely the kind of news we need right now. I promise it's not a shameless co-promotional plug. I'm not even sure that they know this was in here, but Pacific College of Health and Science and all the other acupuncture educational institutions in our country, I'm not sure if everyone realizes what's going on behind the scenes, but PCHS has a new semester starting on Monday of next week, and it is going to be the first time it's 100% virtual. And that is no small effort. I mean, that is Herculean, to be sure. And so I just wanted to recognize Jack Miller, Natalie Tarat, Cynthia Napris, and everyone else that I don't have the time to mention here, because without the continuing learning of our students, our industry can't grow and the medicine can't grow. So thank you, PCHS. This is absolutely the kind of news we need right now. And last tonight, and you know, this list wouldn't be complete without mentioning Dr. John Chen. I personally am in awe. I actually call him a superhero around AwesomeS because he has spent months digesting information, being involved with the research studies that he has mentioned, and making sure that practitioners are as prepared as possible to help patients today and in the future, and countless hours lecturing and imparting that information. So from everyone at AwesomeS, Dr. Chen, thank you very much for sharing. And this is absolutely the kind of news we need right now. As I mentioned earlier tonight, we are navigating this together. LASOMS not alone. We have tried to shift gears as much as possible. But at the end of the day, we still are going to bring in the products you need when you need them, whether that's PPE and Jade windscreen to help in the immediate, or when you start to think about reopening, making sure we have the acupuncture needles and other supplies you need. We also just today launched LASA Direct, and that is a very easy way for you as a practitioner to have your patients buy directly from LASA OMS, and as a practitioner, you'll earn commission on every one of those purchases. We have accelerated our free education opportunities thanks to Jeff Bloom and many others. We moved to daily as well for a time, and now have scaled back a little bit, but we can't thank the educators enough for giving them their, giving us their time. It is just so valuable as people are trying to figure out what to do next. Same focus on service excellence, and we're going to continue to be your partner. It's been 40 years and counting, and we're looking forward to the next 40 years. So with that, I think I will hand it off to Jack Miller, and thank you very much, everyone.
Thanks, Carl. I'm going to try to see if I can share my screen now. I think that worked. And I'd like to pick up around where you left off, Carl, and that's with thanking John. It's just so impressive. I was recently at a new student orientation for our transitional doctoral program, and I encourage them all to come here today because, as many of you, I've seen many of our graduates here, know that that program is about integration, integrating our medicine into the mainstream. And I think today, nobody demonstrates that better. Nobody's a better role model of that than Dr. John Chen. Not only is the content exemplary, but John, your professionalism is really something that we should all admire and hope to emulate. So thank you again for what you've been doing. Just going to go through a couple slides and show you a few things that just bring you up to date on where the college is. Mostly, as you might expect, we're training faculty and students to use the products that we're using right now, mainly Zoom and Moodle, and getting everybody online. It's been a tremendous effort, and I want to thank any of our faculty member and students who are here for really embracing that challenge and working together to make it all happen. As I'm sure many of you are in the same situation, our on-site clinics are closed, and we really look forward to the day when we can open them, and boy, our patients sure do, and I'm sure yours do as well. We've moved most of our clinic training online, doing grand rounds, peer reviews, and homework. And it's going to be going quite well. And we've enlisted many of our friends from Pacific Symposium to be guest lecturers in our clinic grand round. So I want to, any of them that are here and any of them who eventually hear this, this recording, thank you so much. The generosity of our community has been just unbelievable. Or maybe I should say it is believable because I know how great you all are. Our marketing department put up here a few things for you to do if you got some extra time on your hands. We do have a new degree, Masters of Science of Health and Human Performance coaching degree. Some of you have probably attended some of our webinars. If you have any interest, just reach out to us. Some of the things that we've been providing for free to the community, our newspaper is online, and I've done a number of podcasts with people like Matt Callison, Janet Zand, Jake Freck, and Brian Bradley, a number of people. Super interesting. Again, in your spare time, check it out. And I'm sure many of you have attended the master classes that we've been doing just this week. Deirdre Courtney, last week, Lillian Bridges, Peter Holmes, Jill Blakeway, Dustin Dilberg. These are all available on our YouTube channel, and check them out. It's a great way to learn more while we're in lockdown. And again, thank you so much to the people that participated in those master classes. They've been just really very, very well received. And fortunately, or hopefully, I should say, at this point, we still expect our symposium to be live as well as online, as it has been for the last few years. But I think we'll all be looking forward to a time when we can get together physically and high five and real hugs. And so hopefully we'll see you there. John will be there at his booth, I'm sure. And I hope you show your gratitude for what he's contributed to our profession by patronizing his products and his booth at the symposium. I think that's all I have. I want to thank everybody that's participated in all these lectures. Cynthia Nipers, who you saw, introduced John, Natalie Tarot, who's behind the scenes, Miles Exner providing tremendous amount of tech support for us. Definitely can't have this happen without them. And thank you all for really ushering in what may be a new stage for our medicine as the information that John has put together gets into the mainstream. I think that we'll start to see even more people come to us for prevention and at least initial treatment of these serious kinds of infectious disorders. So I'm going to turn it back to you, John. Thanks.
All right, thanks. Okay, let's see. Make sure everybody can see the PowerPoint. Hold on 1 second. Okay. All right. Okay, so once again, thank you to LASA and Pacific College for sponsoring this seminar. And Jack, I think you're absolutely right. I think this year's Pacific Symposium will probably be the best ever because after everybody's home for so long, I think it'll be an excellent getaway. Okay, anyhow, getting back to our webinar. So we have briefly looked at Sanghan, how the traditional perspective has been, and also for all the formulas that are used to treat COVID-19, what their pharmacology effect, what their pharmacological effect is, and how they can actually help the patient to overcome the COVID-19. So let's now switch gear and talk about Wen Bing, which is the warm diseases. So the history is that obviously Sanghan was developed, much earlier, and it was developed during a time when most of the people live in the northern part of China. And then what happened is, as that part of the China became more and more crowded, people begin to migrate and move to other parts. And one of the main direction in which people move is they started to move further and further south. And what happened along the way is that people continue to get sick, of course. That happens at any time, at any place. But the pattern of illness became a little bit different. It's no longer quite the same as the Sanghan progression. The signs and symptoms are a little bit different. But what happened is most of the doctors continue to rely on the traditional wisdom. So what you have to realize is the Chinese philosophy and the Western philosophy in this respect are quite different. Chinese philosophy always tends to be to accept, to adopt, not to question, not to be rebellious or disobedient. And the Western philosophy sometimes is to challenge everything, right? So what happened is as the Chinese population moved farther south and they see different patterns of illness, the Chinese doctors still respect the ancient wisdom of Zhang Zongjing and all the formulas from Sanghan Lun, and they continue to apply the same general principles. But what happened is they noticed that the diagnosis doesn't work very well, the patterns don't fit very well, and the formulas don't work very well. And then a lot of patients were dying and the treatment wasn't working, but nonetheless, they dare not deviate from the Bible of traditional Chinese medicine, so they continue to do the same thing. And obviously, if you do the same thing over and over again, it's still not going to work. So eventually, some of the physicians start to wonder, why is this different? How can it be looked at differently? And how can we treat the patient differently? And that was the beginning of the opposite school of thought, and that is Wen Bing, which is the warm diseases. And that school of thought started with a physician by the name of Wu Youxing. Okay, so this is from his writings. Okay, so Wu Youxing and his background. So this physician Wu lived during the transition from the Ming Dynasty to Qing Dynasty. And once again, it's a period dominated by civil war, characterized by extreme poverty and poor sanitary conditions. So as a result, countless epidemics ravaged the country and killed millions of people. And then at that time, like I mentioned, most of the physicians strictly followed the guidelines of Sanghan, cold damage, and achieved little or no success in treating Wen Bing, warm epidemics. So Wu observed that warm epidemics plagued everyone, starting from one person to the entire household, from one household to the entire street, from one street to the entire village. And to better understand the pattern of this kind of disease, Wu risked his own life and entered the affected households and neighborhoods to personally observe and directly treat those who became ill. So basically, as this picture shows you, that he is at the very front. And obviously back then, without any PPE, mask, goggles, gloves, and so on. But nonetheless, in order to treat the disease, he needs to be there to observe what's going on, what the signs and symptoms are, and basically how to best treat it. All right. So after years of clinical observation, Wu stated that this epidemic, or Wen Yi epidemic, are not caused by wind, cold, summer heat, nor dampness, but rather it's caused by li qi, which is translated as perverse or pestilence qi. And he elaborated that li qi existed in the universe, but has no sound, nor smell, no shape or shadow. And further, he observed that li qi may be transmitted from one person to another via heaven or earth. So heaven, as we know, refers to airborne, and earth is by direct contact. And that it affects those who are weak and deficient the most. So basically those with weak immunity or pre-existing conditions. Okay, so obviously what he didn't know at the time was he was basically describing bacterial or viral infection, basically the microorganisms that have no sound, no smell, no shape, and basically are transmitted from one person to another via breathing or via touch. Okay, so more than likely, this is once again some type of bacterial or viral infection. So he is basically the one that starts this brand new school of thought, which is opposite to Sanghan, co-induced damage, but rather is Wen Bing, warm disease. Okay, so he is credited as the person who started this to characterize the overall different pattern of disease. Okay, and then his work is continued by several other physicians. One of them is Ye Gui, and his name is also known as Ye Tianzi. Okay, so he did a lot of work, and he wrote in a book called Wen Ze Lun, Discussion of the Warm and Hot Disorders, that basically the disease pattern is also from the exterior to the interior. And he classified them in 4 levels, which is Wei, defense level, Qi, energy level, Yin, nutritive level, and Xue, blood levels. Okay, so classification is a little bit different from Sanghan, or 6 stages. But overall, the idea is the same, starting from the exterior, gradually moving into the interior, from mild to moderate to severe, generally in that sequence. And then there was another doctor by the name of Wu Tang, or Wu Jutong, okay, and he wrote a book called Wen Bing Tiao Bian, Systemic Differentiation of Warm Diseases. And he classifies the progression of disease from the upper to the middle to the lower jiao. Okay, all 3 of these physicians did a lot of work to establish the Wen Bing theory, to establish the diagnosis, and also to establish the best formula for treating these conditions. All right, so as we move into Wen Bing, warm disease, basically what we'll be doing is we'll be looking at their work in terms of diagnosis, formulas, and also single herbs, and see how they apply to treatment of COVID-19 today, and also look at the pharmacological effect as well as the clinical evidence of how they can be used today and also in the future. Okay, so this first formula is called Sangjuyin, honeysuckle and forsythia powder. And this is a formula I'm sure most TCM practitioners are familiar with and have used it many times. Okay, so what you see here are the first two herbs are basically the chief herb that represent the formula. And they are Jinyinhua, Lanesra flower, and Lianqiao forsythia. So both of these herbs are very strong herbs that clear heat, okay, specifically wind heat, and also eliminate toxin. Okay, so they make up the chief ingredient in this formula. The main function of the formula is to release the exterior with accurate and cold herbs and also clear heat and eliminate toxins. And the main indication is Wen Bing, warm diseases. So basically, at the very early stage, when the patient has fever, aversion to cold, aversion to wind, slight perspiration, headaches, thirst, sore throat, and so on. Basically, from a Western biomedical perspective, you are looking at this possibly as the early stage of bacterial infection or viral infection. Obviously, it can be a lot of different bacteria or different virus, okay? Caution for this formula is mainly that early wind heat condition can change very quickly, okay? So it can be wind heat one day, but a day later, 2 days later, it can easily move into the lung, and now you can have lung heat, you know, and so on and so forth, okay? So when you're treating infection, ideally, you want to treat the patient, maybe follow up with the patient maybe after 2 or 3 days, okay? And then if the patient is improving, then you can continue the same course. But if their condition change or move interior, then you need to change the diagnosis and change the formula accordingly. All right, so within this formula, Jinyinhua and Lianqiao are the two main herbs. So the one on the upper is, is showing you the picture on the left-hand side. So that's Jinyinhua on the left and Lianqiao forsythia on the right. Okay. And the TCM description is both of these herbs are very similar. They both clear heat and eliminate toxins. So they are great for infection that affect the upper respiratory tract, okay, affect the throat, affect the nose. And you notice that this formula is also great for treating diarrhea or dysentery, right? So once again, COVID-19 attacks primarily the respiratory tract, but may also attack the gastrointestinal tract. So you see these two herbs also fit that pattern. And then both of these herbs show great antiviral effect. All right, so these are their pharmacological effect against many of the virus. Okay, influenza virus, herpes virus, cytomegalovirus, Newcastle virus, and so on and so forth. And then, of course, we are most interested in the specific information regarding COVID-19, right? So this is a journal article that screens many Chinese herbal medicines and their compounds for their potential effect to directly inhibit 2019 novel coronavirus. So in this article, basically it looked at many Chinese herbs and many different compounds and see which herb and what compounds holds promise to treat the virus directly. And what it shows is that Jinyinhua contains 2 active compounds and Lianqiao contains 3 active compounds that directly inhibit 2019 novel coronavirus. And then furthermore, this is another article that further explore the exact mechanism of action of how these herbs work. Okay, so it talked about the update on epidemiology, clinical, preventative, therapeutic evidence, guidelines, and so on and so forth. But basically, the specific information I want to bring you to is that Jinyinhua, Lanesra flower, and Lianqiao interfere with the spike protein binding to the ACE2 receptor to block the viral entry of the SARS virus. So if you go back to our virology chart, right? So once again, the virus is outside of the body at this point, right? So it's in the air space, in the alveolar sac. And then the pink space is inside the pneumocyte, the lung cell. So the first step that has to happen is a spike protein has to bind to the ACE receptor, ACE2 receptor, before endocytosis can occur, right? Because our cell has its own defense system. It's not going to let anybody in, all right? So this is a lock and key and the combination allows the virus go inside the body. So what happened is Jin Yinhua and Lianqiao, Lanisra flower and Forsythia, both contain compounds that will block this spike protein binding to the ACE receptor, right? So if you can block the virus from getting in the very first place, then you can block all the subsequent steps and then basically avoid the virus infection into the cell. All right. Also, in this other article, small molecules targeting severe acute respiratory syndrome human coronavirus. So this article specifically also says that Jin Yinhua also inhibits the SARS-CoV replication. So in addition to blocking the entry, it also affects some step over here to block the replication of the virus. So obviously that happens because, as we see here, each of the herb has multiple ingredients to help to directly act on the coronavirus. Okay, so when you have multiple ingredients, chances are you also have multiple mechanisms of action. So this is one mechanism of action. The other one is somewhere in the cell to block the replication of the virus. Okay, so that's why Jin Yinhua and Lianqiao make such an effective pair, in that they have antibacterial effect, they have antiviral effect in this specific case. They also have specific antiviral effect against the SARS coronavirus. Okay, and now we know exactly how they work. All right, another formula that's also from the Wen Bing theory, this is called Sang Ju Yin, mulberry leaf and chrysanthemum decoction. And obviously, once again, the name tells you what the active ingredients are. So it's Sang Ye, which is mulberry leaf, and Ju Hua chrysanthemum. And in addition to those two chief herbs, you notice there are also a lot of other herbs that are the bitter and cold heat-clearing herb. So once again, you have Lianqiao, Forsythia over here, right? And we have some overlapping herbs from Sanghan formulas, such as Ku Xing Ren, that help to direct the qi down to relieve cough, and also Gan Cao, which is to harmonize the formula. Anyhow, this is a formula from Wen Bing Jiao Bian, right? So basically it's from the Wen Bing theories of formulas. And from a TCM perspective, these two formulas both dispel wind and clear heat. They ventilate the lung and rest coughing. So basically this is for the wind warm syndrome that's affecting the body at a very early phase. So not so much the headache, the sore throat, but basically the thirst, the cough, and the mild fever. And historically, I'll be honest with you, I haven't used this formula very much because potency-wise, it's about mild, maybe slightly moderate. So it's not a very strong formula from that sense. And what happened is a lot of time in the US, patients are not very patient. You know, when they come for treatment, if they are used to taking drugs, if they are expecting immediate results, generally speaking, this formula is not that potent. Okay, so you may not see immediate effect. So for that reason, I haven't personally used this formula very much. But what happened is it's actually used quite a bit and shows great benefit for COVID-19. So historically, it has some antipyretic and anti-inflammatory effect. Once again, mainly to help to reduce fever and treat inflammation. These are what the herb look like, the mulberry leaf and also the chrysanthemum flower. Okay, and the TCM function of these two herbs are mostly to dispel wind heat, also to clear lung heat, and also to clear liver heat. Okay, so they help with the eyes as well. And pharmacological effect, you see that it has, these formulas have antipyretic effect, anti-inflammatory effect, and also some antibacterial and antiviral. Okay, and according to the same research, once again, it's the research that screens for the Chinese herbs and their direct effect to treat or inhibit 2019 coronavirus. So once again, Sang Ye and Ju Hua both have multiple compounds, in fact, 2 compounds for each herb that directly inhibit the 2019 coronavirus. Okay, and once again, what they do is they interfere with the spike protein binding to the ACE2 receptors. Okay, so exactly the same path here as Jin Yinhua and Lianqiao. Okay, so once you're able to prevent or interfere with the binding, you prevent the viral entry into the cell and all the consequent effect that happens afterwards. all right? And that's why if you think about it, that also makes perfect sense from a TCM perspective, right? Because Sangjuyin and Inqiaoshan are both used for the early stage of wind heat or wind warmth, right? And early stage is obviously you want to prevent the virus from actually going inside the lung cells, all right? So that makes perfect sense, once again, from the traditional TCM indication. And now we look at the virology or the herbology of how the herb actually work inside the lung cells, okay? Unfortunately, if the disease becomes more serious, okay, there is a formula, and this is actually one of my favorite formulas. It's called 普济消毒饮. 普济 means universal benefit, and 消毒 means to eliminate decoction. So usually when you hear the term 毒, which is this word here, du, okay, 毒 means toxin. Okay, so anytime you hear the word or see the word 毒 toxin, that means this is a condition that is, quote unquote, not caused by wind, not caused by heat, not damp or summer heat, right? This is actually something that you cannot see or smell or touch. So basically, anytime you see the word 毒, you are most likely looking at a formula that treats infection, either bacterial, viral, fungus, parasitic, whatever the case may be. And as these microorganisms get into the body, you have the macrophages that eat them up and process them, and then you have death, or the bacteria or virus may kill the cell, and you end up with apoptosis of the cell. And then the macrophage had to come up and clean it up, you know, and then you create a lot of pus and abscess and discharge. And those are all basically toxins, starting from the bacteria to the virus to the pus and the abscess and so on. So the whole thing is described in the general term toxin, okay? So that's what 毒 is, to eliminate toxin. And that universal benefit refers to the fact that when at the very beginning, when they try to treat this warm disease, like I mentioned, they fail many, many times, and the patient continues to die with the Sanghan theories, right? So finally, when this doctor, Li Gao, come up with this formula that worked very well, he luckily did not keep this as a personal secret formula to only pass on to his son or his disciples, but rather he actually carved the composition of this formula on the rocks at the center stage of the town. So everybody can see what is the most effective way to treat this. So they can treat the entire universe that have this same disease. And once again, that universe is the same household, the same village, or the same town. Okay, so that village really, that universe basically is defined by the group of people, wherever they are, okay? And the reason this formula worked very well, if you look at the ingredient, you'll see a lot of herbs that are all heat-clearing herbs that eliminate toxins, right? You start out with Huangqin and Scutellaria and Huangli and Cactus, right? So these are the herbs that we use quite a bit, basically to treat all kinds of bacterial and viral infections. Then you also have Lianqiao for Scythia. So we talk about that herb having bacterial, antibacterial effect, but it's also a very good antiviral. In fact, the antiviral effect is probably stronger, right? You also have Shensen Scrophularia, which is also a very strong heat-clearing herb. But in this case, I want to bring your attention to Banlangen, which is Isatis. And Isatis is another herb that has great effect to clear heat and eliminate toxin. Okay, it's also used quite a bit for treating all kinds of bacterial and viral infections. But what happened is it's not used that much in the earlier part of TCM, but it's used quite a bit in the Wen Bing theory in the last, 300-400 years or so. Okay, so its use has picked up quite a bit more recently, and by that I mean the 300 or 400 years. So the formula as a whole is a great formula to clear heat and eliminate toxins, dispel wind, and disperse the pathogenic factors. The TCM description of this formula originally is this is to treat 大头瘟, which means it's an epidemic that's primarily affecting the head, right? So the patient may have ear infection, nose infection, throat infection, and eye infection, and so on. And basically anything that affects from the neck up, okay? And there's a lot of infection, there's a lot of heat, a lot of pain, and so on and so forth, as you can see from all the signs and symptoms. All right. And as far as the chief herbs go, 板蓝根and 大青叶 are two herbs from the same plant. And a lot of time, most of the formulas today, in fact, combine both of them at the same time. And the reason is because you get a much better synergistic effect that way, okay? And both of these herbs, in fact, have a lot in common. Both are excellent herbs to clear heat and eliminate toxin. So once again, clear heat, you treat the infection and inflammation. And when you say eliminate toxin, once again, you're talking about the effect to treat infection, either bacteria or virus, okay? And then cool the blood and benefit the throat, okay? The pharmacological effects are also very similar. They both have great antibacterial, antiviral, and anti-inflammatory effect. And another one that's very, very important is they both have antitoxin effect. And what I mean by that is a lot of time what happens is the bacteria and virus will cause the infection. But what happens is when they die or when the body try to kill them, they cause complications on their own. So what happens is when the neutrophils or the monocyte, when they release the chemical to kill the infected cells or to kill the bacteria, basically the cell, bacteria, and the cell disintegrates, right? And when it disintegrates, the bacterial cell wall will release all the liposaccharides and the virus will release all the particles. Then what happens is that sometimes triggers the hyperactive immune response, okay? And then you end up with more immune system trying to take care of the problem, but then they over respond and they create additional problem. And that additional problem is fever, too much inflammation, and too much damage to the cells, healthy cells. So when you have herbs that have antitoxin effect, basically they help to treat the hyper responsiveness by the immune system to cause fever and to cause inflammation. All right, so these herbs, not only do they treat the infection and inflammation, but they also treat the antitoxin response due to the over response by the immune system. Okay, so these two herbs have many, many effects to treat multiple aspects of infection and inflammation. All right, and as you can see, Banlangan has many, many different effects to treat many different viruses, including influenza, including swine influenza, encephalitis virus, SARS coronavirus, and so on and so forth. And then Daqingye is the same. Daqingye also has excellent antiviral effect against many different viruses. Okay, specifically, once again, there are many medical journals that talk about different herbs and their mechanism of action as far as how they treat different viruses. So in this case, you actually have the entire article dedicated to Banlangan. So the article is anti-SARS coronavirus 3C-like protease effect of Isatus indigo root. So that's Banlangan and other plant-derived phenolic compounds. So most of the article, in fact, is dedicated to Isatus indigo. And what it basically says is that Banlangan is a great herb. It contains 3 main active compounds, which are sinigrin, indigo, and beta-cytosterol, that have direct effect to inhibit the 3C-like protease. And that's abbreviated as 3C-Pro of SARS coronavirus. So what happened is, like we mentioned earlier, virus is over here. It binds to the H receptor. It goes inside the cell. The RNA or the cell virus is released. So the RNA can be duplicated. And also the virus will hijack the ribosome to make the spike protein, the envelope, and so on. And that can only be made through the 3CL Pro. So Banlangan had 3 main active ingredients that will block this process. Okay, so the virus cannot make the proteins that are needed to coat the virus before it's released. So basically, if this step is inhibited, even if you are able to produce all these extra viral RNAs, they cannot be released, they cannot survive. Okay, so that will basically terminate the replication of the virus if you're able to block this step over here. Okay, so it's no longer the initial stage, it's a little bit farther down the line. But nonetheless, if you're able to block it over here, if the virus cannot replicate, it can no longer affect other virus of the host. it can no longer affect other people that are next to them. All right, so one way or the other, regardless of which pathway that you inhibit, they will all have some antiviral effect to treat the viral infection. So once again, this is specifically the SARS coronavirus. All right. Here's another formula called 甘露消毒饮. So 甘露 refers to sweet dew, and 消毒 is to eliminate toxin. So the eliminate toxin part remains the same, and it's called 甘露, basically to help you paint the picture that this formula has a lot of dew, have a lot of fluids. So for patients that have a toxin type of infection that dries out the body fluid, there's a lot of fluid deficiency, indeficiency, and so on, then this would be the best formula to use. Okay, so once again, if you are trying to eliminate toxin, then you need a lot of herbs that are bitter and cold, that clear heat, that eliminate toxin, that have antibiotic, including antibacterial or antiviral effect. So once again, you have Intenhua, which is a great which is a great herb to use. You have Huangqin scutellaria. So once again, that's a herb that treats lung heat very effectively. And also you have Huoxiang, or more specifically Guanghuoxiang pogostemon. And this is a herb that treats heat mostly in the digestive tract. So Dampi in the digestive tract. Okay, and also Lianqiao, Forsythia. So once again, this is a formula that has many herbs that are bitter and cold, that treats heat, that clears heat, eliminate toxin, to directly treat the infection. The indication is resolve dampness and treat dissolved turbidity, clear heat, and eliminate toxins. It's specifically for damp warmed febrile disease or epidemic disease affecting the Qi stage, or mostly also the digestive system. So it's able to treat the respiratory tract and also digestive tract. And as you can see here, the patient may have vomiting, they may have diarrhea. So digestive tract is definitely affected. All right. And the main herb I want to bring to your attention here is Guanghuoxiang. And by the way, there are two types of Huoxiang that have been used historically. One is Huoxiang, or more specifically Tu Huoxiang, and that's the Agastache. And the more accurate one that should be is Guanghuoxiang pogostemon, because they've gone back to the historical records to look at the description of the herb and see which Huoxiang it is. And they identified that historically, in fact, Guanghuoxiang was the more accurate herb, even though historically they just used Huoxiang. So today, generally what they do is, to avoid confusion, they separate Huoxiang into two separate entities. So if you say Tu Huoxiang, that's Agastache. If you say Guanghuoxiang, that's pogostemon. And if you don't say anything, generally the default is going to be pogostemon, Guanghuoxiang. So anyways, this is an herb that dispels damp, relieves exterior, relieves summer damp. It's primarily for treating the infection in the digestive tract. So basically, when we say damp heat in the digestive tract, it's referring to a localized infection and inflammation. So that localization is in fact the digestive tract. So this herb, and one of the formula that uses this herb as a chief herb, is Huoxiang Zheng Qi San, right? So that's the pogostemon formula to correct qi, right? So it's a great formula for treating food poisoning, for treating traveler's diarrhea, for treating dysentery, and all those GI infections. All right. So this herb has antibacterial, antiviral, antifungal effect. It's great to treat pain, reduce inflammation, but basically, it's to treat all kinds of gastrointestinal disorders. It's kind of like the herbal equivalent of stomach 36, if you will. Okay, so it's a great herb to treat digestive disorders. Okay, and this article, unfortunately, is in Chinese, but basically it looked into the pharmacology of the formula and also all the ingredients from the formula Qing Fei Pai Du Tang, which is a lung cleansing and eliminating toxin decoction, right? To see how the formula works. And what happened is, this is one thing I did mention earlier, is that Qing Fei Pai Du Tang is made out of 4 main formulas. But one of the herbs that is added is Guanghuoxiang, and Guanghuoxiang is not a herb in any of those 4 formulas. So this formula specifically adds Guanghuoxiang because Guanghuoxiang is a very good herb to treat the potential GI aspect of the COVID-19 infection. Okay, so that's why Guanghuoxiang is used, and that's why it's one of the most important herbs
within this Ganlu Xiaoduyin formula, right? And the reason specifically for COVID-19 is that Guanghuoxiang contains an active ingredient called patchouli alcohol. And this herb has been shown to act specifically on the ACE2 receptor to prevent the entry of the virus. And at the same time, this compound also inhibits the 3CL protease to suppress the viral replication and both of the coronavirus. So once again, you can see that it's one herb and one compound, but it's able to act by blocking the ACE2 receptor to block the viral entry, and also to block the 3CL protease to block the replication of the virus. So basically, it's one herb, one compound, but it has more than one mechanism of action. So once again, this is a very important herb. And this herb is also very good because once again, it's good to treat virus that may affect the body through the digestive tract. It's also good to treat the virus that may affect the body through the respiratory tract. Okay, so this is a great herb, not only from a TCM perspective, and also explains very well from a Western medicine perspective. Okay, the next formula is called Qing Wen Bai Du Yin, clear epidemics and overcome toxin decoction. So the formula specifically tells you it's a formula for treating epidemic infection that affects a large amount of population. And once again, Du, toxin, is part of the name of the formula. So you might have many words. You might have defeat the toxin, overcome the toxin, eliminate the toxin, expel the toxin. And that's just Chinese way of trying to visually describe the same thing, but using slightly different terminology. Anyways, if there's toxin, once again, it's an infection, inflammation type of condition caused by the microorganism. So once again, you have the same two herbs that I use quite a bit. One is Huanglian coptis, that's best for the middle jaw infection, so for stomach. You also have Huangqin scutellaria, and that's best for the upper jaw, for the lung infection. But then beyond that, you also have many, many other heat-clearing herbs, right? You have Zhizi gardenia, that's good for upper, middle, and lower jaw. You have Sigao and Zimu that are good, excellent pair to treat fever, okay? Then you have herbs that are good for deficiency heat. That includes Seng Di Huang, Fresh Rumania, Chisao, Red Peony, Mudanpi, Cortex Mountain Redices, Lian Qiao for Scythia for the early stage, and then and so on and so forth. So it's almost like a shotgun approach of many heat-clearing herbs to treat excess heat, to treat deficiency heat, to treat heat at different parts of the body. So you can kind of think of this formula from a Western sense as a very potent and broad spectrum herbal antibiotic. All right, so the description of the function is clear heat and eliminate toxins, purge fire and cool the blood, and this is great for treating Wen Yi, warm epidemics with excess heat and toxins affecting both the qi energy level and xue blood level. So it's basically both when it's in the most severe phase, and also once it's past the middle phase and get into the yin stage or blood stage, it's still effective. All right, and let's focus our attention on two of the main herbs. One is Huanglian coptis, and then the other one is Huangqin. All right, so once again, these two herbs are described and frequently used together as a pair, and they are great for upper and middle jaw. So for respiratory tract infection and also digestive tract infections. And the TCM description is that they are great for clearing heat, dry the dampness, eliminate the toxins, okay, and so on and so forth. The pharmacological effect, as you can see, is pretty much like what we know, including antibacterial, antiviral, antifungal, anti-inflammatory. And both of these, like Banlangen and Da Qingye, which are the Isatus root and leaf, also have antitoxin effect. So they will treat the infection, they will treat the inflammation and all the complications of the inflammation. All right. So once again, you have many studies. In this case, it's Journal of Clinical Virology. They look at 10 clinical isolates of SARS coronavirus and to selected antiviral compounds. So once again, this is kind of a drug company approach, pharmaceutical company approach. They want to narrow the variables down to one compound and see whether this one compound has effect to treat one disease. All right, so in this case, it was found that Huangqin has this one main ingredient called beikalin. which works to inhibit the replication of the SARS coronavirus. And in addition, it also has effect to inhibit the binding of the virus to the ACE2 receptor to block the entry. So once again, Huangqin blocks the entry by binding to the ACE2 receptor. It also blocks the replication of the virus. So once again, Huangqin has multiple mechanisms of action to treat specifically SARS coronavirus infection. Okay, and this is an interesting slide. Okay, this is an article that I came across, more or less looking at COVID-19 from a statistics perspective. And what they did was they went through all the medical journals, they went through all the different hospital, province, and national protocols as far as how to best treat coronavirus. So they took statistics of what formulas are used the most and what single herbs are used the most among different approaches from different hospitals and city and state and national level. So kind of like, you know, statistic level. So based on their countdown, the #1 most frequently used formula is 麻杏甘石汤, right? So that's the second formula that we talked about. And basically, again, you know, COVID-19 affect the lung the most, right? So 麻杏甘石汤 is a formula that treats lung heat. So it's no wonder this is a Sanghan co-induced formula approach, and that's the most frequently used. And that's followed immediately by Inchaosan, Lanisra, and Forsythia formula. So this is the #1 formula for treating Wen Bing, now from a Wen Bing school, right, to warm diseases. So Shanghai, this formula is cited 29 times. In Chaosan, it's cited 28 times, you know, and so that's quite interesting. It's basically a tie. And then as you go through the list, what happened is most of the formula makes perfect sense, except there was one formula that I remember studying in school and writing about it in the formula book. But after that, I never see it again. I've never used it after that. And I also never have any practitioner that asked about it. And that formula is called Da Yuan Yin, which is over here. And it's cited 18 times, so relatively speaking, it's quite high. So that actually piqued my interest. Why is that formula used over here? So that formula, Da Yuan Yin, basically means to reach the membrane source decoction. And the formula is somewhat bland, right? If you look at it, it has Binlang, Areca, C, Hopu, Magnolia cortex, 草果 fructus 草果, 知母 Animarina rhizoma, 白草 white peony, 黄芩 Scutellaria, and 草果 甘草 licorice. So basically, one herb, 黄芩, as a heat clearing herb, and most of the other herbs are to move the qi, to dry the dampness, and to eliminate phlegm. You know, and none of the herbs are particularly potent or different. You know, and yeah. So anyways, that was my first observation when I look at the composition. And then if you think about it, right, you know, the formula is called Da Yuan Yin. Da is to reach, and Yuan is Mo Yuan. Mo Yuan means membrane source. So then I started thinking, I wonder what the author was trying to say when he says Mo Yuan, right? If you look at the origin of the formula at the bottom, right, this formula is from Wen Yi Lun, discussion of epidemic warm disease, and it's composed by the doctor Wu Youxing, and he's the first doctor that came up with a Wen Bing theory, right? So he's the one that made the early observations. So basically what he said is, you know, for these patients that come up with these warm epidemics, the warm epidemics affect the body and they go far and very deep into the body. So in order to treat the condition, you have to reach equally as deep all the way to the membrane source. You know, and if you think about it, membrane source, what exactly is membrane source? So once again, let me see if I can show you this from a diagram perspective. Well, actually, first look at me if you can. If you think about it, right? If you say if you make a light fist like this, right? If you look at the air inside, okay, would you consider that air to be inside or outside of the body, right? So most people would agree that it's just outside of the body because it's never part of the inside, right? What about if the air is inside the mouth, right? Well, it's still outside, you know, because just because there's an opening in my mouth, it's really, you know, not inside of my body, inside by the way of, you know, physically inside, not just through a loop, all right? And then obviously, if you go further and further, what about the air inside your lung? Well, I would argue it's still not inside the body, okay? What about the air that's inside the alveolar sac? Well, it's still not in the body yet, all right? So when does it actually go inside? I would argue that when the air, or specifically the oxygen, when it leaves the alveolar sac, crosses the membrane, and goes into the blood vessel. At that point, the air is literally inside the body. Okay, so what's the source of the membrane that separate the outside and inside of the body? Well, that is the alveolar sac membrane and also the blood vessel membrane. And both of these membranes are extremely thin. And that's what allows the air to go in and out, and also the fluid to sometimes go in and out very easily. All right, so this is the membrane source. Okay, so when this formula says to go reach the membrane source to treat the source of the disorder, it's basically reaching this far deep to treat the phlegm, to treat the dam, to treat the tannin, right, if you will, the visible and invisible phlegm that's inside the alveolar sac, or perhaps even further, to treat the fluid accumulation in this interstitial space. All right, so I think that's my interpretation of what Moyuan is, all the way down to the meeting point is, between the alveolar membrane and the blood vessel, where the oxygen exchange actually takes place. So this formula, according to Wu Yoxin, goes all the way there to the membrane to eliminate dampness and turbidity. And we know today that COVID-19, it's not so much the virus that causes the disease at that point. It's kind of like a forest fire, right? Or a household fire. You might have the stove that starts the fire initially, or you may have some camper that's accidentally set fire in the fireplace. But once the house catches fire, once the forest catches fire, and it's starting to get out of control, it's more important to put out the fire to figure out, well, it's the stove that started it, or it's the campsite that started it. Same with the forest fire, right? So same thing with COVID-19. You might have the virus, that starts this infection. But what happened is by the time that it caused cytokine storm and caused ARDS and multiple organ failure, the problem now is no longer the virus. The problem now is all the complication that's caused by it, all right? So you need to go beyond the virus to treat all these other complications that may kill the patient, right? So this is a formula that perhaps it's an attempt to treat the source of the problem, to get rid of the damp and the phlegm, and basically the excessive response by the immune system. Okay, and then interestingly, there are also pharmacological effects that look at what this formula tries to do and try to figure out exactly how it regulates or how it treats COVID-19. And what they found is that this formula basically have two possible mechanisms of action. One is to regulate the T cells. So that's basically to regulate the immune system. And the other is to bind to the ACE2 receptors to block the entry of the virus. And basically that effect most likely is coming from Huangqin scutellaria and the bakelin, right? So we talked about Huangqin and bakelin earlier, that it's able to block the ACE receptor and inhibit the replication of the SARS coronavirus. So that function most likely comes from bakelin, from Huangqin, but then the formula as a whole also regulate the T lymphocytes to help to regulate the immune system. All right, so even though the formula does this, you can trace it back to know what compound and what herb, in fact, carry out this particular function. All right, so those are all the formulas that are commonly used in Wen Bing theory, the worm epidemic, worm disease theory. And in addition to that, let me share with you a few other single herbs that have shown great effect to treat specifically SARS coronavirus. And these are the herbs that you may or may not have thought of in terms of using them to treat infection. So the first one is Myanmar Guanzhong, which is Dryopteris. This is primarily a anti-parasitic herb. But what happened is, in addition to its anti-parasitic effect, it also has the effect to clear heat and eliminate toxins. So what happened is there are so many herbs that have the effect to clear heat and eliminate toxins. It's probably not most people's first choice as far as what herb to select to treat COVID-19. But as it turned out, it's one of the best herbs. In addition to anti-parasitic effect, it has great antibacterial and also antiviral effect. And then specifically, this herb contains a compound called camphorol that has effect to inhibit 3C protease and PL, which is papain-like protease, to directly inhibit SARS-CoV-2 virus. So it's not just SARS-CoV-1, it's SARS-CoV-2. So basically, this herb and this compound blocks both of these proteases. So it has a much more comprehensive, extensive effect to block the virus ability to synthesize the protein that it needs to encase and release the virus. Okay, so once again, one herb to block two pathways of viral replication. Okay, another herb is called Xiangcunye, which is a tuna seneca leaf. So I think for 99, or maybe even 99.9% of the TCM practitioners, they probably have never heard of this herb. And in fact, I didn't learn about this herb, the specifics, until about 5 or 6 years ago. Okay, so basically this is an herb that clears heat and eliminate toxin from the lung to treat cough, but it also has the effect to clear heat and eliminate toxin from the skin to treat various types of skin sores and abscess. So that's the classic description. But what I found out is I came across a lot of medical journals. And once again, this is the one medical journal dedicated to this one herb, right? So it says Journal of Ethnopharmacology. Tuna sinensis tender leaf extract inhibits SARS coronavirus replication. And specifically, what they found is that this herb has a selective effect to bind to the SARS-CoV virus to inhibit the cellular entry into the host cells. Okay, it also has the effect to inhibit the replication of the coronavirus once it goes into the cell. So once again, it has two mechanisms of action. The first one is to selectively bind to the spike protein. So it doesn't affect the ACE2 receptor, but specifically for the virus. So once again, I think the more specific it is for only the virus, the better it is. And this is basically how antibodies work too. Antibodies identify something on the surface of the virus and specifically attach to it and deactivate it or kill it, okay, without affecting the cell receptor or the rest of the cell. So the more specific for the virus, the better. And then it also helps to inhibit the replication of the virus somewhere inside the cell. So once again, it inactivates the virus, it stops the replication of the virus. If for some reason, some does get through and some does get into the cell. So once again, more than one mechanism of action from this herb. And according to the researchers, who screened specific herb in both Sanghan Lun, discussion of cold-induced disorder, and Wen Bing Tiaobian, systemic differentiation of worm disease. So these researchers screened all the herbs and all the compounds they can find, and they found Xiangcunye to be the most effective herb to treat SARS coronavirus. So that's quite a statement from the researchers. Okay, and like I said, most of the TCM practitioners probably have never heard of the herb. Then you have an herb called Wu Beizi Gala chinensis, and as you can see from the description, this is an herb that belongs in the astringent category or stabilize and bind category. So basically, stabilize and bind mostly the lung and the intestines. It binds the lung to treat coughing. It binds the intestines to consolidate the urine, to consolidate the discharge, basically to treat diarrhea, to treat leakage of body fluids, frequent urination, spermatorias, and so on. And interestingly, in this article, small molecules blocking entry of severe acute respiratory syndrome coronavirus into the cell. So basically, they are looking at which molecules will help to block the entry of the virus into the host cells. And what they found out is that Wu Beizi contain this one compound called TGG, which is tetra-O galileo beta D glucose, that it has a prominent anti-SARS virus activity. And quote, this compound has the highest affinity among all compounds we have studied to bind to the surface spike protein S2 of the SARS coronavirus and interfere with the entrance of the virus into the host cells. It has you can use it at very high concentration without substantial cytotoxic effect. So once again, this is from the description, very specific, very effective, and generally speaking, non-toxic. So this once again is quite interesting because the Chinese description of this herb is it's a binding herb. And then the mechanism from a pharmaceutical perspective is exactly that. It binds to the SARS virus spike protein. In fact, not just the spike protein, but the S2, there's S1 and S2, to the S2 spike protein of the SARS virus. So very, very specific description of what it does. And it happens, once again, mirrors TCM and Western medicine. So I thought that was fascinating. Okay. And then beyond those few and all the ones that I mentioned earlier, there are many, many other herbs and many other compounds that have been studied as far as which herb and which compounds has effect to specifically block many different paths of the SARS-CoV life cycle. And those other herbs include gancao, licorice, dahuang, rhubarb, or ray, Herbal, polygonal multiflorum, 荔枝核, lychee seed, 草果, which is fructus 草果, 泽贝母, frutillaria, 紫石, aurantium, 陈皮, citrus peel, 石酸, licorice, and so on and so forth. Okay, so I didn't share these ones with you because they don't tie in very well necessarily to the TCM patterns of differential diagnosis. Okay, meaning if these herbs have some compounds that happen to show some effect to treat SARS-CoV-2, it doesn't mean the herb as a whole fit in very well. So for example, dahuang is a purgative herb, right? So if you see in the article that dahuang contains emodin, and emodin is great for SARS-CoV-2, and you decide to use this herb as a single herb at a large dose to treat COVID infection, well, what's going to happen is the patient is going to have severe diarrhea every single day, and that's not a very good treatment strategy, right? Or if you see gancao, licorice, in fact, the study of gancao is actually published in Lancet. Okay, I think it's glycyrrhizin, the compound, that shows good effect to block the replication of the virus, right? And it's published in a very reputable journal, the Lancet. That if you decide, oh, that's a great study, I'm going to use gancao at a very large dose to treat COVID-19, well, then chances are what happened is that one compound may work, but the rest of the herb and all the therapeutic effect doesn't make sense. Using gancao at a large dose really doesn't make sense from a TCM perspective, and you may in fact make it worse, because what also happened is gancao, like we mentioned, influence the adrenal gland and has anti-inflammatory effect. But what also happened is when you influence the adrenal glands, you will increase the production of glucocorticoids and mineralocorticoids. And then what happened is they will cause water retention, they will suppress the immune system, and that's not a good overall treatment strategy for the patient, all right? So even though these herbs contain compounds that may fit somewhere in this picture, make sure they also fit into the overall picture of the herbal formula to treat COVID-19. Or more specifically, what I should say is to treat the patient that has COVID-19. That way, the overall treatment will make sense, okay, and the patient will get better. So that's a brief look into a topic called the structure-activity relationship. And basically, it's one of the courses that we all have to take as a pharmacist to look at the structure of the drug, and based on the structure, based on the molecules, how it may affect certain enzyme, may affect certain molecules, certain receptors, and how basically this compound carry out the therapeutic effect. And if you think about it, this is basically the drug company approach. The pharmaceutical company tried to go from molecule in depth and go outwards. And then Chinese medicine tried to look at the patient as a whole, and they go inwards. Okay, the path is different. One is looking from the outside in, and one is looking from inside out, but the goal is the same. The goal is to treat the COVID-19, the goal is to treat the patient. And you can argue until the end of time which one is better, but I would just say it's different approach, and our goal is the same. Our goal is really to treat the patient, to treat the disease. It's just that our path to get there may be slightly different. Okay, so that wraps up our first two schools of thought, which is Shanghan and Wen Bing. Okay, and once again, these are two main theories, and we can argue once again till the end of time what's better and what's not, which one we should use to treat COVID-19 or to treat the patient of COVID-19, or more specifically, how are they different, right? Because if you think about it, what happened is Shanghai started out in the northern part of China and Wen Bing in the southern part of China. But does that mean that if you have a patient in northern hemisphere, maybe in Alaska, you should use Shanghai theory and formulas? But if the patient is in California or Texas, you should only use Wen Bing, and you cannot flip it around? Okay, probably not the case. Or if you think about it, right? If you have used a Shanghai type of protocol, then what happened is Shanghai also talked about lung heat, right? Also talk about wind heat. So is it only cold, or does heat also apply? And same with Wen Bing as well. Okay, so in the end, what happened is, even though there are two different schools of thought, they actually share a lot of things in common. But what I think, this is my personal opinion, of the main reason they are different is it's more of a philosophical difference than anything else. So what happened is, when you go back to the Shanghai diagnosis and Shanghai formulas, what happened is most of the formulas are aimed to help the patient to help themselves. They help the patient to relieve the pain, to reduce the fever, to modulate, to regulate the immune system. But most of the Shanghai formulas really don't have bitter and colder to treat the infection itself. So basically, this is like the idea of helping the body to help themselves. And this falls in line with the Tao, the philosophy. And the Tao is to do by not doing, right? So you're treating the disease by not treating the disease. You're helping the body, you're helping the patient to help themselves, okay? So that's mainly the philosophy of Shanghai. And Wen Bing, what happened is you see many formulas that eliminate the toxin, right? So what happened is they go right in and bam, and treat the disease, right? They don't wait for the patient to get better. They don't wait for the patient to help themselves. They go in and they directly just take care of the problem. And this falls in line of the philosophy of Fa, which is authoritarian. So they go in and they just bulldoze and treat the problem. Okay, so and you can tell from all the herbs and all the formulas that we looked at, most of the herbs are bitter and cold. Most of the formulas are to eliminate toxins. So they go in, they have direct, they have potent, they have broad spectrum herbal antibiotic, herbal viral, antiviral, and herbal antibacterial effects. So they go in and take care of the problem. Okay, so once again, when do you use which one? Well, then, once you know the philosophical difference, I think it becomes a lot easier, right? So think about this, right? If you have an adult that is otherwise healthy and they come in and they have mild signs and symptoms of COVID-19, well, chances are this patient will heal and recover on their own. They may just need a little bit help. So Shanghai is probably a better choice. But what if you have a patient that comes in and they are older, they have pre-existing health condition, and they show more severe signs and symptoms of COVID-19? In fact, they are showing, maybe shortness of breath and dyspnea, and they have high fever, right? So if you have those conditions coupled with the pre-existing condition, well, it might be too hard for the patient to overcome the condition on their own, right? So Wen Bing is probably more appropriate this time. You need to go in and take care of the disease with the herbs. So you need the strong, bitter, and cold heat-clearing herb that have antiviral effect. Or sometimes you can even combine both. There's nothing wrong with it, right? And if you think about the Qinghui Paidu Qinghui Paidu Tang, right? In addition to all the Shanghai formulas, it added Guanghuo to more specifically, it's basically an herb to take care of the COVID-19. But once again, once you know all the tools, there's nothing wrong with mixing and matching to come up with the best treatment strategy. And what happened is, regardless of whether you prefer Shanghai, cold damage, or Wen Bing, warm disease, what happened is everybody can agree that 预防 prevention is probably the most important part. Because if you can prevent the infection, then that beats treatment anytime, that beats treatment any day. Okay, in fact, it's not Chinese medicine, Western medicine also believe the same. Okay, so this is an article that talked about COVID-19 infection, the perspectives on immune response. So inside, this is my favorite phrase. We believe that a two-phase division is very important for COVID-19. The first, immune defense based on protective phase, and the second, inflammatory driven damaging phase. Doctors should try to boost immune response during the first while suppressing it in the second, right? So obviously in the early stage, when the virus just got in and they are slowly replicating, You want the immune system to be as active as possible to kill, to block, to eliminate as much as possible. But once the infection take hold, once the lung cells are dying, once 7 days or later, the viral load is at its maximum, right? So that's what I mentioned. Somebody started the fire in the kitchen, but now the whole house is burning. You don't need to worry about the fire in the kitchen anymore. You have to take care of the whole house, right? So fire in the house is the early stage of the virus, and the fire in the whole house is later stage when the immune system goes berserk, right? So this article also stressed that immune defense is very important in the beginning, except unfortunately in Western medicine, there's nothing available. Okay, there's no Western medicine for boosting the immune system in the beginning to fight the infection, except one thing, and that one thing is convalescent plasma, right? They take the plasma from the patient that got the infection, that heal, and basically take the antibody from the plasma and give it to the sick. Okay, so that's the only option they have. But the limitation of that is it's hard to find these patients. There's only so much blood you can get from them. And in time of pandemic, you're just not going to have enough to treat everybody. And also the Western medicine model or the insurance model, unfortunately, is they pay for the treatment. They don't really pay for the prevention. So there's very little incentive for the doctors and the drug company to have anything for prevention. So this is an area that I think Chinese medicine far outshines Western medicine, to help to prevent and minimize the exposure to the virus, to fight out the virus before the disease sets in. All right, and this, in case of COVID-19, is especially important because the virus not only attacked the lung and the digestive tract. What happened in the first episode of SARS in 2003, they noticed that SARS also caused lymphopenia, or SARS is associated with lymphopenia, which is a decrease in the lymphocytes, which is your white blood cells, right? So SARS not only caused disease, but SARS also attacked the white blood cells and caused a decrease of white blood cells, so your body has an even harder time to overcome the infection. And now they also see this in SARS-CoV-2. So SARS coronavirus 2, the one that caused COVID-19, also infects the T lymphocytes and kills the T lymphocytes. But fortunately, the virus cannot replicate inside the T cells. So in addition to infecting the lung cells, replicating the lung cells, the virus also kills immune cells. And basically, in the end, the virus dies and the T cell dies. So it's like it's a kamikaze type of effect. But nonetheless, once you have less T cells, your body becomes immune compromised, and it becomes even harder to treat the infection internally. So what can you do? Okay, so what you can do is, in addition to all the physical barriers, and that's PPE, that's a mask, that's a glove, that's a goggle, that's the social distancing, we can use herbs to boost the immune system, so our immune system is stronger to fight out the virus on its own. So this is the most popular formula for that, called 玉屏风散, the J windscreen powder. So we have the three main herbs: huangqi, astragalus; baisu, astragalodus; fangfeng, siler. And this is the exact preparation protocol. Even though it's called a powder, it's actually taking the powder of the herb plus senjiang, fresh ginger, and dazao, jujube, and cook it into a decoction. So decoction is still better than the powder itself. Basically, the formula is to tonify wei qi, which is your defense qi, to ward off or to defend the infection. From a pharmacological perspective, astragalus will basically promote the generation of your T cells and also promote and activate your B cells. So T cell has to do with a more immediate innate defense, and B cell is to adaptive defense. All right, so basically it will provide you with an immediate and long-term protection against the infection. And that same thing can be said when they study the formula. So this is an article that look at the analysis of immunostimulatory effect from the polysaccharides extracted from 玉屏风散 in vivo and in vitro. And what they found out basically is the same thing. The formula 玉屏风散has an immunostimulant effect. you will increase the proliferation and phagocytosis rate of the macrophage. So this is the Pac-Man cells. You will enhance both T cells and B cells. So this is your innate and adaptive immune response. And also you will elevate the levels of cytokines. And this is your basically the chemicals produced by the white blood cells to fight the infection. And that includes nitric oxide, tumor necrosis factor, interleukin, and also interferons. All right. And basically from a graft perspective, the immune tonics doesn't work inside the cell because that's basically what heat clearing herbs do, but rather they help to stimulate, increase the macrophage to eat up the virus, and also the T cells and B cells to specifically identify and kill the virus. Okay, so that's basically what qi tonics, or specifically Huang Qi and Yu Ping Feng San does. And in fact, there's one more mechanism. In this study, it says that Yu Ping Feng San, an ancient Chinese herbal formula decoction, induces gene expression of antiviral proteins and inhibits neuraminidase activity. So what does that mean? What that means is after the virus gets into the body, the RNA is released and replicate all the RNA materials and all the polyproteins. The virus has to assemble itself, right? And once it's assembled, it has to leave the cell. But when it leaves the cell, it is still attached. It is still tethered to the lung cell, right? So it's kind of like if you have a boat that's tethered to the pier, right? So when the boat wants to go, you have to undo the rope before the boat can leave. So this neuraminidase is basically the last piece. When the rope is released, then the virus can go off, and it needs this enzyme called neuraminidase. So Yu Ping Feng San, by stimulating the immune system will indirectly inhibit the neuraminidase, so the virus cannot leave the cell, it cannot leave the whole cell. So the virus goes through all these steps, okay, but it cannot leave the whole cell. So it cannot infect other cells, and it cannot infect other patients, okay? But eventually what may happen is the virus is basically trapped inside the original host cell, and the host cell will probably die, but at least you leave the minimal number of casualties. It doesn't affect the other parts of the cells, all right? As far as Yu Ping Feng San and also Huang Qi, the main caution and contraindication is that if the patient has a pre-existing autoimmune disease, if the patient is taking immunosuppressants after organ transplant, or if the patient is a patient with cytokine, is at risk of cytokine storm, then you don't want to stimulate the immune system any further. So in those cases, don't use Yu Ping Feng San, Jade windscreen powder, don't use Huang Qi, astragalus, and also don't use Sen ginseng. Okay, because the consequence of stimulating the immune system too much is quite serious. Okay, and then as far as clinical studies go, I mentioned this in the last webinar already, so I'm not going to I won't spend too much time on it. This is a study back in 2005, and basically what they want to do is look at whether an herbal formula will prevent the hospital frontline workers from catching SARS. And basically what they did is they had two groups of patients. They had 1,063 that took herbs and 15,374 that did not take herbs. So they basically go about their daily activity as usual. And this is the herbal formula they took. It's basically a combination of Yu Ping Feng San, Jade windscreen powder to strengthen the immune system, Sangjiyin, mulberry leaf, and chrysanthemum formula. And this is a formula in the Wen Bing theory, right? To treat the early stage of wind warmth. And then lastly, they added two herbs, Da Qingye, Isatus leaf, and Huang Qin Scutellaria. And both of these are the herbs that we mentioned have strong antiviral effect. So anyway, they took 4 grams of herb every day for 2 weeks. And what they found is that the herb group, there were 0% infected. And in the control group, or the non-herb group, there were 64 infected, about 0.4% of the total number. And the p-value is 0.035. And what that means is we can say with 95% confidence that the herbs work to prevent SARS infection. Okay, and if you fast forward, this is done in 2005 to today, there is a study that looked at this and looked back at this, basically saying that, well, what can we do? You know, now we have COVID-19. So they cite back to the original article saying that, well, the immune boosting herbs are probably the best choice. And in fact, you'd also mentioned that the original study that was done in 2005, they are doing a repeat study. Okay, so they started to recruit patients in March of 2020. And once again, the study protocol is exactly the same. They give the patient the same formula, 4 grams a day for 14 days. And they are trying to see whether this same formula will also help to prevent COVID-19 or SARS-CoV-2, as opposed to originally, which we have SARS and SARS-CoV-1. All right, so this study they started to recruit patients in March of 2020. So it might be a while before they finish the study and publish the results. So personally, I cannot wait. You know, I have been in contact with the lead author of this study, and we'll see what happens. Hopefully, you know, within a month or two, they release a result. That way, we can present this to the hospital, to the academic institution, to the government, and say, look, we have, you know, evidence that the herbs do work, not just in the lab, not just in, you know, subjects, not just for, you know, SARS, but specifically for prevention of SARS-CoV-2 or COVID-19. Okay, and you know, you have this upside, which is it helps to prevent the infection, and the downside, you know, there's really no downside. Herbs are relatively inexpensive, and the side effect is just very few people that end up with some GI side effect. So the benefit is significantly higher than the potential drawback. And then there's another spin-off, and this is another study that look at using the formula to see if you can use it to treat specifically SARS-CoV-2, okay, or the coronavirus. Watch it now. They are looking at this formula for exactly what it does to the immune system. All right. So anyhow, this is the original formula with a little modification in this particular study. So the root part, the base part is the same. Then they added Yuxing Cao, Hutanania, Qingfengteng, Cinnamomum, Lingzhi, Ganoderma, and also Yunzhi, Coriolis or Trematis. The study did not disclose the dosage of the herbs. So these are the ones from the textbooks for your information. So what they did basically is they have 80 subjects, and each one of them take either the placebo or the herb 4 grams a day for 7 days. And what they found out is on day 7, which is the end of the study, that the herb group shows a significant increase in T lymphocytes, in cytotoxic T lymphocytes, T helper lymphocytes, and also NK cells. So basically, many different immune cells are greatly increased. So the patient will have much better effect to fight off whatever infection they may have. And then on day 21, so basically 2 weeks after they stop using the herb, the cell numbers goes back to the base level. So what you can take back from this description is that by day 7, taking the immune tonics, chances are the herb is working at its peak level, okay? But if you stop the herb, let's say today, generally speaking, the effect will wear out after 14 days. Okay, so if you ever have a patient that asks you, well, how long does the formula take before it starts working? And then once you stop, how long does it work before it stops working? And the answer is it will work very well, reach the peak within 7 days. And then if you stop, then 14 days later, chances are the effect will be gone as well. And then what happened is of the herb they decided to add to this base formula, they found 2 that work very well specifically for SARS-CoV-2. And those are Lingzhi and Yuxing Cao. And Lingzhi, once again, historically, we're not using classic formulas, but it's used quite a bit today for its immunomodulatory effect. Yuxing Cao historically is used to clear heat and eliminate toxins. So you can expect it to have good antiviral effect. So in this study at the end, what they said is that in addition to tonifying the immune system, okay, these 2 herbs, GL is Ganoderma lucidum, which is Lingzhi. HC is Hutanania cordata, which is Yuxing Cao. They have strong effect to inhibit SARS-CoV, RD-RP, and 3CL Pro, respectively, to slow down the viral growth and minimize the effectiveness. So what that means is Yuxing Cao inhibit the 3C Pro. Okay, so we talked about that already. There are many herbs that do that. And then Lingzhi inhibit the RD-RP, okay, which is RNA-dependent RNA polymerase. And it's this pathway over here. So Lingzhi basically block the replication of the viral RNA. So all the herb we talked about so far, This is the first herb that does that. Okay, and guess what drug this herb has in common? Okay, which antiviral, let me put it, which antiviral drug do you think work on this pathway that block or interfere with the RNA replication? Okay, so this is a Jeopardy question. And the answer is remdesivir. Okay, so you probably have heard about it. This is the most promising antiviral drug at this point in time. You know, they have finished, in fact, I think it was yesterday or day before yesterday, just the initial trial, and remdesivir severely shows excellent promise as an IV injection to treat the most severe, sickest COVID-19 patients. Okay, so the Yingzi basically work on the same pathway. The exact mechanism is a little bit different, but I think it's very important because obviously this is a very important pathway. If the virus cannot replicate its own RNA, then no matter how much protein it replicates, it's completely useless. Okay, so this is a very, very important pathway over here. Okay, and then in addition, you have another article that's dedicated only to Yuxintao, immunomodulatory and anti-SARS activity of Yuxintao, Utanania cordata. So what they found is that not only does it block the viral replication, Yuxintao also boosts the cytotoxic T cells and helper T cells, the replication, and also block the virus. So basically, Yuxintao work on a multiple mechanism as well. Help the immune system to treat the virus, block the RDRP, and also block the 3CL protease. So once again, Yuxintao is one of the herbs that has multiple pathways. And in fact, if you look at my last webinar, Yuxintao is used quite a bit to a lot of the classic formula. So once again, if you add it to a Wen Bing, Sanghan formula, you have the Sanghan formula that help the body to help itself. If you add Yuxintao, you also have the herb to help the patient to treat the infection directly. So once again, you can target the disease and help the patient all at the same time. So Yuxintao is a indispensable herb for treating the patient. All right. So lastly, we talk about prevention. We talk about treatment. And generally speaking, this is where Western medicine ends. Okay. Patient tested negative for SARS-CoV, for COVID, the virus, 2 separate times in 24 hours. Then they are sent home. Okay, and that's it. But what happened is that is really not the end. It's kind of like we supposedly have passed the peak of COVID-19 here in the US, and we are on the downward trend, right? So many of the states are thinking about opening back up. But what happened is opening back up is not the end. There is a long and difficult adjustment period before we really get back to normal. Okay, so this is a recovery phase that unfortunately Western medicine doesn't really address, but we definitely need to. Okay, and because what happened is when you have all these damage that's caused to the lung, it's going to take a while to heal and recover. And you don't want the patient to do that on their own. You want to help them as much as possible. Okay, so most people, in fact, all the references that I looked at all agree that the patient will have lung yin and lung qi deficiency. And the best formula to treat it is Sha Shen Mai Dong Tang, which is Glenea and Ophiopogonus decoction. And Sha Shen, you can either use Nan Sha Shen or Bei Sha Shen, it doesn't matter too much. So it's either Glenea or Adenophora. So either one is fine, okay? Then you have Mai Dong, Yu Zhu, Tianhua Fen, Shang Ye, and so on. Most of these are very nice and gentle yin tonics to help to repair yin. And if you think about it, what is yin? Yin is the structure and qi is the function, right? So when you have COVID-19 that damages the lung cells and it compromises the lung function. So lung cell, type 2 pneumocyte dead, that's the yin deficiency. And what's the qi? What qi is the function of the lung. So once you improve the structure, you will improve the function. So this formula primarily improves the function structure, but if you need to improve the function, then you can add some other herb to tonify lung qi. But anyway, this is a great base formula to start. Okay, clears and nourish lung and stomach. Yeah, so it's good for stomach, lung insufficiency, stomach and spleen and digestive tract. So if the COVID-19 happens to attack the GI tract, this is also good. Okay, this is the TCM indication. This is a Western indication, basically for chronic atrophic dryness, damaging type of disease affecting both the digestive tract and respiratory tract. Okay, what also happened is if you have patients in which this is a severe case, they have cytokine storm, they have ARDS, ARDS, and so on, then what happened is you do have the fibroblast that comes in to repair the damage, and that leaves with scar tissue. So it's not just an insufficiency, this is a severe form of blood stasis. So in tonic by itself is not enough, you really need blood stasis removing herbs. So when I did the research at clinicaltrials.gov, there were 11 studies for TCM for treating COVID-19, and one of them is a blood-moving formula specifically for scarring of the lung. Okay, and this formula is called 扶正化瘀, which translates to support the righteousness and resolve the blood stasis. So this is a study that initiated in February of 2020, but it's a long study. They're not going to conclude for at least 2 years. And what they basically do is they have one group that is a drug group plus placebo, which is here. And then the other group is drug group plus the formula in tablet. And the formula is very simple. It's basically a simple formula with 2 blood-moving herbs. Dansen, salvia is a blood that moves the qi. Paozen, persica is another herb that moves the qi. Then you have dongcong, xiacao, cordyceps that mostly tonifies qi and tonifies yang. So basically, once again, you're treating the structure and you're treating the function. You're treating the anatomy, you're treating the physiology, right? So the damage to the lung is the in damage is the blood stasis. And the function is the lung function, the breathing, right? So once again, you need to treat the structure and the function, the anatomy and the physiology. Okay, so that completes the whole picture from beginning to the middle to the end, or the best way to look at the whole picture of how to treat, COVID-19. Okay, from hopefully you have some idea of how to look at it from a traditional Chinese medicine perspective to what's done in China today. You can look at it from a Chinese perspective with description of yin and yang and damp and cold and heat and so on, but also hopefully from a pharmacological perspective, from a molecular perspective, and then some clinical studies to back up, whatever that you happen to say, to educate the patient, to the medical doctors, nurses, and so on. So for me, this makes the most sense when you are able to see the whole picture. Then you can see exactly where you need to go, what you need to do, and what is the best way to combine Chinese medicine and Western medicine, to combine Sanghan and Wen Bing, to integrate prevention and also recovery into the entire course of treatment. And I think when you're able to see the whole thing, then you are no longer afraid. You are much more confident, to help the patient and everybody along the line. All right. So to summarize, basically what I think is prevention is still the most important. So if nothing else, definitely follow all the standard protocol, which is quarantine, social distance, mask, gloves, so on and so forth, wash your hands. And you should do that. And we do that from a Western medicine and traditional Chinese medicine perspective. But I think Chinese medicine, I put a little plus over here because we also have herbs that can be used to boost the immune system. Okay, and Western medicine, of course, they use convalescent plasma, but that's very hard to obtain. So herbs are very effective, very low cost, and readily available. Maybe not so readily available today because with the pandemic, most herb companies are completely out of 玉屏风散. But nonetheless, the point is that's what you need to do. Okay, and then what happened is for the 81% of the COVID-19 patients, fortunately, the signs and symptoms are mild. They can heal and recover on their own. But for the patients here in the US, the troubling part is initially they think they have it, but the Western medicine will tell them, sorry, you're not sick enough, or sorry, we don't have tests, just go home and quarantine yourself. And today, hopefully they can get tests. But what also happens then is they get tests and they show up positive. Then sorry, we can't treat you yet, just go home and self-quarantine. And if you are the patient with positive COVID-19 diagnosis, it's very unnerving, right? You have the diagnosis, but Western medicine has nothing to treat you. There's no treatment, there's no cure. And then you're supposed to go home and self-quarantine. Then what about your family? Do you come in contact with them or not at all? Do you self-isolate for 14 days? it's very nerve-wracking, it's very uncomfortable, it's not a good situation to be in, to know you are sick with this disease, but there's nothing Western medicine can do. But at this point, what happened is Chinese medicine really has a lot to offer. You can use Sanghan theory and formulas, or you can use Wen Bing theory and formulas. And I think both of them work very, very well. And once again, it depends on your personal philosophy and also the patient, right? Once again, if the patient is healthy, otherwise healthy, no particular problem, Sanghan is perfectly fine. If the patient has a more severe symptom, they're elderly, they are weak, they have pre-existing disease, then chances are you want to add in some Wen Bing theory and bitter and cold herb that have antiviral effect to give the formula a little extra boost to treat the infection. But whatever approach you take, 81% of these patients will benefit greatly from the Chinese herb. And if you go with the 80-20% rule, this is basically where you can make the biggest difference of all the patients. Prevention and also early phase when they are first diagnosed with the condition. And if they get past that, then it becomes progressively much harder to treat. Once they have to be hospitalized, okay, then Western medicine can give them ventilator, they can give them immunosuppressants, they can give them whatever drug, and those drugs are indeed very powerful. But at that point, there's not too much we can do in the Western countries, right? Very few of us really have the privilege to go to the hospitals and then do acupuncture or give them herbs. Chances are most of the hospitals won't allow it. And if you are able to, then chances are it's going to be very hard to treat these patients at this point anyways. So once again, if you want to make the biggest difference, focus on the prevention, focus on the early stage. When they are at the moderate phase, then I would say Western medicine and Chinese medicine, they are about equal as far as how much we can help the patient. But if the patient do progress to ICU, they have severe case, then Western medicine is much better. They can give the patient life support and keep them alive and give the patient a fighting chance to recover. In the old days, okay, there's no way, regardless of whether you are Wu Youxing or Yes Tianshi, chances are those patients are not going to make it, because the patient, when they go from mild to moderate, they are fine, but all of a sudden they fall off the cliff and the condition deteriorate very quickly, and it's very hard to save those patients. Even if you're in China, what happened is at that point, the oral use of decoction is not enough. Oftentimes they have to use injections. They make the herb into injection and they inject the patients in addition to everything else. And even then, it's very hard to save the patient. And that's why when we talk about statistics, right, they talk about trying to prevent the patient from deterioration from a mild to moderate phase and prevent them from moderate to severe phase. Because once they go to severe and go to ICU, it's very hard to treat. And then finally, if the patient are discharged, they are negative for COVID-19, then once again, Western medicine really doesn't do anything. They just send you home, and I think this is an area where TCM can also make big difference. Again, post-discharge recovery, you can do that much better with TCM. Okay, so once again, hopefully you can see the big picture from the beginning to the mid to the late, of what we can do for the patients. Okay, so once again, hopefully, if you have had a chance to watch the first and the second and the third webinar, and this is my trilogy of how TCM treats viral infection, specifically COVID-19. Hopefully, you have a good idea of exactly what you need to do or what we can do from many, many different perspectives. So you don't get bogged down, somewhere along the line of treatment or communications and so on. And then finally, I want to leave you with a philosophical paradigm. For those of you who are interested in the Chinese language, crisis, okay, in Chinese is called Wei Ji. Okay, Wei means 危险, which is danger, and Ji means 机会, which is opportunity. And that means with every crisis, there is an equal amount of danger and opportunity. The greater the danger, the greater the opportunity. And we can all agree that this is probably as big as danger goes. And what that also means is we have a great opportunity to educate ourselves and also to educate and make a difference for the medical system. Okay, and I spent probably the last 2 or 3 months, no less than 4 to 6 hours a day just on this topic. basically to go to the historical literatures, contemporary literatures, or the medical journals, TCM and Western medicine, and so on, to put together these 3 webinars. And hopefully, those who have watched it benefited from it. I mean, I did put in a lot of information, but in any case, my point is, for those of you who are still working, kudos to you, trying to help the patient as much as you can during this difficult time. And those of you who are staying home, definitely take this opportunity to learn as much as you can, whether this is for COVID-19 or any other area that you have always been interested but have not had a time to look into. This is a great area, great time to do additional learning. Fortunately, there's a lot of CEUs are available online. So definitely look into that. And I think this is a great time to come out of the crisis much better prepared for whatever we need to do, whether it's for COVID-19 or anything else. Okay. And then if you get a chance, all these things that I show you are available at the elotus.org website. We have a resource page. You can get all the government information for WHO, NIH, and so on. You can get information from Western medicine perspective and also TCM perspective. Okay, so all the links, all the articles, all the PowerPoint handouts, and so on and so forth are all there. Okay, and then lastly, Cynthia says she's going to compile all the questions and send them to me. So I'll try to answer them. Or if you have a specific question or something confidential or specific patient, you are more than welcome to email me directly as well. And my email address is at the bottom. Okay, so thank you for giving me 3 hours of your time. Hopefully this movie has been worthwhile. So with that, I would say thank you very much. And hopefully I'll see you again sometime in the near future.
Thank you from Pacific College. Thank you to LASA OMS for co-hosting this webinar. Thank you, John, for your generosity, your clarity, your stamina for this marathon of super helpful information. In the chat room, you've been called a hero, a treasure. People are standing and cheering if they can do that online. This webinar was riveting, and I'm sure many of us will watch it again and maybe again. Thank you to all of you who attended. We know you will carry this out into your practices and make a real difference in this pandemic. Pacific College of Health and Sciences motto is changing lives exponentially. And tonight, John, you are doing that, changing lives exponentially. And now all of those who are listening are ready to go do that too, changing lives exponentially. Please remember to get Dr. Chen's books if you don't have them already, and to visit the LASA OMS table as well as the Evergreen table at Pacific Symposium. And again, John, a thank you from all of us.
Well, thank you for hosting the webinar and help to provide the platform for all of us to get together and help each other out. Thank you so much.
Thank you.